e solidário pode transformar o envelhecimento em uma oportunidade para ser saudável, para viver plenamente, para aceitar a mudança e continuar aprendendo e se desenvolvendo. Acreditamos que todas as pessoas têm o direito de prosperar em qualquer idade, adicionando dignidade aos anos, bem-estar aos anos, vida aos anos. Década do envelhecimento saudável nas Américas. Adicionar vida aos anos.
Vivemos em um mundo que está evoluindo mais rápido do que nunca e no qual a expectativa de vida aumentou 20 anos em meio século. Pela primeira vez, a sociedade e a tecnologia avançam mais rápido do que a vida de uma pessoa ou de uma geração. Nunca antes, 6 gerações compartilharam o planeta. Gerações que nasceram antes da existência dos antibióticos hoje convivem com gerações mais jovens que nasceram em plena revolução biotecnológica e de alta conectividade social. A aspiração é que esse presente de 20 anos na expectativa de vida se traduza em um benefício e não em um fardo. O fato de as pessoas viverem mais, permanecerem doentes por mais tempo e, portanto, ficarem mais tempo vinculadas aos serviços de saúde são motivos que demandam novas abordagens. O ganho de 20 anos a mais na expectativa de vida exige que as capacidades físicas e mentais da população sejam plenamente desenvolvidas e que durem por mais tempo. Isso permite não apenas sobreviver, mas prosperar e contribuir ativamente para essa transformação rápida e exigente. É por isso que a saúde não pode ser considerada apenas como uma aspiração abstrata, mas deve ser entendida e medida como um recurso e uma capacidade tangível. Entender que a saúde não acontece por si mesma e que deve ser construída ao longo da vida, ao mesmo tempo que é influenciada por condições sociais específicas, é essencial. O documento Construindo a Saúde no Custo de Vida busca motivar a academia e as estruturas de saúde a olhar para a saúde por meio dessa visão inovadora. Mas, além disso, pretende motivar a aplicação da abordagem do custo de vida na prática da saúde pública para, assim, abordar melhor os fatores que influenciam e determinam as trajetórias de saúde de indivíduos e populações, consequentemente, a sua capacidade de desenvolvimento humano.
The Americas, a dynamic region full of diversity. and yet the most unequal in the world. 201 million people still live in poverty. Illnesses such as obesity, diabetes, hypertension, and high cholesterol are more prevalent among poor and vulnerable populations. The mortality rate is twice as high for children under 5 with undereducated mothers. And every year, 2 million babies are born to mothers between the ages of 15 and 19. It is our duty to protect those who are most in need. We will do whatever is necessary to ensure that no one is left behind. We've been doing so for over a century, and we're not going to stop now. Because our determination doesn't stop. Our dedication doesn't stop. Our commitment to our communities doesn't stop. And because life doesn't stop. Health is the most precious resource we have and an engine of sustainable development. It helps to close gaps and reduce inequalities. Investing in resilient healthcare systems is vital for their recovery and preparation for the future. However, no single nation or organization can tackle the health challenges facing the Americas alone. We are the partner of choice to promote public health and the best resource to improve the quality of life in our communities. We provide coverage in all countries, management and supervision of projects at the regional and national level, knowledge and networks in all areas of healthcare, capacity to convene people, mechanisms of transparency, and experience with responding to emergencies. Building partnerships has been essential to improving healthcare in the region. Life expectancy has increased by 36 years. The mortality rate for children under 5 has been reduced by 67%. Hundreds of millions of people have been able to get vaccinated and obtain access to medicines. Smallpox, polio, rubiola, and measles have been eradicated. Each of these achievements demonstrates what can be attained through collaboration. And yet, we still have much work to do. Many people's lives depend on us. Let us continue working together to bring health and hope to every corner of the Americas. The Pan American Health Organization.
Aunque no lo sientas, está aquí. El aire que respiramos es un derecho. 9 de cada 10 personas viven en ciudades con niveles de contaminación que exceden las recomendaciones de la Organización Mundial de la Salud. La contaminación del aire no tiene fronteras. Es un problema global que produce inflamación de las vías respiratorias, enfermedades cardiovasculares, neurodegenerativas, nacimientos prematuros y envejecimiento de la piel, y acaba con la vida de aproximadamente 7 millones de personas por año. Podemos reducir los niveles de contaminación exigiendo leyes que limiten la emisión de gases y partículas, utilizando modos de transporte limpios, haciendo una buena disposición de los residuos, optando por la eficiencia energética. Eres parte de la solución.
La région fait face à une imminente crise à cause de la chute du nombre d'enfants qui reçoivent tous les vaccins. En 2021, aux Amériques, 2,7 millions d'enfants de moins d'1 an n'ont pas reçu ou complété leur série essentielle de vaccination due à l'interruption des services de santé provoquée par la pandémie de Covid-19. Aussi, la pandémie a aussi touché la surveillance de ces maladies et les systèmes de laboratoire. La région pourrait n'être pas capable de détecter la prochaine émergence d'une maladie évitable par la vaccination avant qu'elle devienne une pandémie multinationale. Dû à la relation étroite parmi les épidémies et la vie en société, nous faisons face à un risque pas seulement sanitaire, mais aussi bien qu'un risque économique, éducatif et social. Nous avons besoin de réduire le risque d'importation et de propagation de maladies qui ont été éradiquées des Amériques, comme la polio, la rubéole ou le tétanos néonatal. Pour réussir, les États membres, les partenaires et l'Organisation panaméricaine de la santé devront travailler ensemble pour renforcer tous les aspects des programmes d'immunisation en investissant ses ressources financières et en augmentant le nombre de personnels formés qui puissent assurer des services d'immunisation et son intégration au système d'attention primaire de santé. Ceci seulement arrivera si les gouvernements et les partenaires forment des engagements politiques et économiques pour arrêter ces écarts d'immunisation. Comme principal collaborateur de la région dans tous les sujets de santé publique, l'OPS est complètement capable à aider aux États membres pour privilégier leurs besoins les plus urgents et exécuter des actions en faveur de la vaccination. Nous continuons avec notre collaboration fructueuse pour renforcer les programmes nationaux d'immunisation dans toute la région. C'est possible de surpasser cette crise. Ensemble, nous y avons réussi dans le passé et nous allons le faire encore une fois. Organisation panaméricaine de la santé, 120 ans. Nous sommes l'Organisation panaméricaine de la santé, célébrant 120 ans de solidarité dans la promotion de la santé et du bien-être des personnes, sans laisser personne de côté.
The pandemic has impacted many, but not everyone in the same way. Women and girls of all ages weathered the crisis with increased caring responsibilities resulting from unequal gender roles.
The 19 pandemic has been difficult on us all, especially on our young people. It has affected our educational system. Students, both old and young, became subject to learning remotely, not being able to socialize with our friends, with our peers, with our loved ones, has affected us both mentally and emotionally.
In the region of the Americas, over 10,000 healthcare workers lost their lives responding to COVID-19, many of which were women who comprise 70% of the frontline care and represent only 25% of managerial positions. Yet, men have shown higher mortality rates due to COVID-19, including disproportionate infection and deaths in certain ethnic groups. Gender and masculinities shape their health outcomes and that of those around them.
La pandemia del COVID puso a prueba el mandato de la masculinidad que nos dice a los hombres tienes que ser libre y estar fuera del espacio doméstico. Al no poder hacerlo, provocó en los hombres mayor tensión, irritabilidad, frustraciones, enojos, malestares, que los hombres aprendimos a no expresar, a acumularlos. Ante esto, los papás podemos aprender a ser afectivos, asertivos y diversos en la expresión de nuestras emociones y malestares a través de ser corresponsables, afectuosos, procurar cuidados, tiempos, comunicación con respeto.
A reality of our region is that pre-existing systemic inequalities endanger COVID-19 health outcomes, and affect the resiliency and recovery of communities and countries. In our response to the pandemic, only 24% of women sit on national task force, whereas they are responsible for 80% of domestic tasks, including caregiving. Ensuring gender equality in care economies must be the foundation of building resiliency and sustainability.
Do we even know the true impact of the pandemic on women? We need to be in the know. And moreover, you and I must be the champions for the universal elimination of gender and health inequities during pandemics and beyond. I know that there can be no sustainable development without gender equality.
Diabetes is a global epidemic and a major public health problem in the Americas. That's why PAHO is implementing the Global Diabetes Compact, a new framework to improve diabetes prevention, diagnosis, and treatment. It starts with improving type 2 diabetes prevention and early diagnosis of type 1 and type 2 diabetes, and learning from people living with diabetes, enhancing the quality of care for people living with diabetes through treatment and prevention of complications, improving monitoring of people living with diabetes and measuring trends in diabetes, with the goal of reducing the risk of diabetes and ensuring everyone living with diabetes has access to quality, comprehensive, and affordable care. Learn more about PAHO's regional implementation of the Global Diabetes Compact in the Americas to create synergies for action and harness the collective capacity of partners working with countries to improve diabetes prevention and control across the Americas.
La salud es el recurso más valioso y un motor del desarrollo sostenible. Ayuda a cerrar brechas y a eliminar inequidades. Invertir en sistemas de salud resilientes es vital para la recuperación y la preparación para el futuro. Pero ninguna organización o nación puede abordar los desafíos de salud en las Américas por sí sola. Somos el socio de elección para promover la salud pública y el mejor instrumento para mejorar la calidad de vida de nuestras poblaciones. Tenemos cobertura en todos los países, capacidad de gestión y monitoreo de proyectos a nivel regional y nacional, conocimiento y redes en todas las áreas de salud, capacidad para convocar, mecanismos de transparencia y experiencia en dar respuestas a emergencias. Las alianzas han sido esenciales para mejorar la salud en la región. La esperanza de vida aumentó 36 años. Las muertes de niños menores de 5 años se redujeron un 67%. Miles de millones de personas se han podido vacunar y acceder a medicamentos. Se eliminó la viruela, la poliomielitis, la rubéola y el sarampión. Cada éxito demuestra lo que la colaboración puede lograr. Pero todavía queda mucho por hacer. Las vidas de muchas personas dependen de nosotros. Llevemos juntos salud y esperanza a cada rincón de las Américas. Organización Panamericana de la Salud.
Frente a la creciente crisis de salud mental en el contexto de la pandemia COVID-19, la OPS ha incorporado la salud mental en su respuesta a la emergencia por COVID-19. El programa MHGAP pretende reducir la brecha de acceso a los servicios de salud mental, capacitando a profesionales de salud no especializados para que puedan identificar, manejar y referir a personas con condiciones de salud mental.
El curso MHGAP nos dio varios aportes. Uno de ellos fue el fortalecer conocimientos. Algo fundamental también fueron los indicadores de salud mental.
Entonces, el curso está diseñado de tal manera que podamos nosotros tener una estructura apropiada para dar la capacitación, dar el seguimiento, dar la supervisión y que el personal del Ministerio de Salud Pública tenga acceso a este tipo de información y pueda hacer una evaluación, un diagnóstico y un tratamiento en las comunidades.
El curso se da mucho en este énfasis, en esta parte comunitaria para poder disminuir la brecha de atención y más ahora en este periodo de pandemia.
Por ejemplo, un aporte importante que yo rescato mucho es la conformación de un equipo operativo a nivel de gestores local. Los gestores que gestionan medicamentos, gestores que tienen recursos humanos, con un sistema integral de salud.
Entonces, lo que se quiere es iniciar el trabajo allí de tal modo que en cascada se vaya difundiendo la guía MHGAP.
En el Hospital de Salud Mental se implementó la utilización de llamadas telefónicas para darle seguimiento a los pacientes. Junto con otros colegas, somos partidarios de esa transformación de la salud mental que tiene que existir en nuestro país y a nivel mundial, donde haya acceso a la medicina, haya un tratamiento en la comunidad, haya un tratamiento con el idioma, con las condiciones de cada persona.
Cardiovascular diseases, diabetes, cancer, and chronic respiratory diseases are known as non-communicable diseases. In recent years, these diseases have increased as a result of population aging, urbanization, globalization, and changes in lifestyles, and they've become the great epidemic of our age. Non-communicable diseases can largely be prevented by adopting a healthy lifestyle, but to do so requires more than simply personal determination. For example, when wholesome food is more expensive and less available than junk food. When physical activity is a challenge because the parks and recreation areas are not safe or properly equipped. or when it's hard to quit smoking or drinking because advertising of these products seems to be all around us. That is why laws and regulations are needed to make the healthy choice the easiest choice. Without these laws and regulations, more and more people will develop a non-communicable disease and need lifelong treatment that could ruin them financially. But there's still time to stop this epidemic from growing, and some countries in the Americas have already taken action by, for example, reformulating processed foods to make them healthier, informing consumers about the nutrition content of packaged foods, making more fresh foods available, regulating the sale of junk food in schools, as well as providing free drinking water, increasing taxes on tobacco, alcohol, and sugar-sweetened beverages, facilitating access to quit smoking programs, banning tobacco use in enclosed public spaces, and limiting the advertising of cigarettes, alcohol, and junk food, creating opportunities for physical activity, including creating recreational bicycle paths and promoting the use of public transportation. Governments should ensure access to health services for its population, including access to early detection of disease, diagnosis, medicines, and treatment provided without discrimination and without undue financial hardship. People should be provided with information and support that empowers them to manage their own health, giving them greater control over their health and contributing to the health of their families. This way, all together, we can stop this terrible epidemic from getting worse.
Good morning, muy buenos dias, bom dia a todos. França é número 21. Nós estamos quase lá. Ai, eu vejo Guyana entrando na sala.
I see Guyana walking into the room.
Perfeito, muito bom dia a todos.
Good morning, everyone.
We're ready to go. Ready to go.
Okay. Buenos dias. Bom dia. Good morning. Bon matin. We are now in the final throes of our meeting. Hope to get finished today, this morning. For anybody who has a hotel room here, we need to finish before noon because that's checkout time. So we're going to try to see if we can get through all our agenda without requiring a health or coffee break, but we'll see how it goes. So as you know, based on yesterday's, as we ended yesterday, we have just 2 items left, but each item has a multiple element to it. Item 8.12 is our first. Progress reports on technical matters. Document CSP 30/INF/12. A series of progress reports, and we'll take them each individually. First one will be the sub-item A, Plan of Action for Cervical Cancer Prevention and Control 2018-2030 Progress Report. And Dr. Hennis, if you're in the room, come on up. And I will turn to the Executive Committee representative to report on this item. The floor is yours.
Thank you, Mr. President. Good morning, everyone. In the Executive Committee's discussion of the progress report, delegates reaffirmed their support for the plan of action and their commitment to controlling and eliminating cervical cancer as a public health problem in the region. They also expressed support for the actions recommended in the report to improve the situation. Several delegates noted that the impact of COVID-19 pandemic on access of HPV vaccination, pap smear testing, and oncologic diagnostics and treatment services, and underscored the need to build more resilient health systems and services capable of sustaining such services while also responding to a health emergency. The need to strengthening digital cancer registries was also emphasized. In addition, delegates highlighted the need to address persistent myths and misconceptions about HPV vaccination. Thank you, Mr. President. This concludes my report on this item.
Thank you. Open to delegations for comments. Anyone like to comment? I recognize Antigua and Barbuda, followed by Canada.
Thank you, Mr. President, and good morning to delegates. Antigua and Barbuda thanks the Secretariat for this progress report on the Plan of Action for Cervical Cancer Prevention and Control in document CSP 30 Information 12. Cervical cancer prevention and control remains a priority for the government of my country. And over the last few years, we have taken steps to establish a comprehensive cervical cancer prevention and control program. In terms of governance, we have reconstituted our Cervical Cancer Task Force that oversees the organization of our program. Members are responsible for prevention, screening, and treatment for cervical cancer. And in terms of prevention, the HPV vaccine was introduced in 2018, and uptake was better than expected until the COVID-19 pandemic, when we saw a decline in persons being vaccinated. Therefore, between 2018 and 2020, we utilized approximately 3,800 doses of HPV vaccines. We are now taking steps to improve HPV vaccination uptake. We are pleased to have been working with PAHO and Basic Health International over the last few months on Antigua and Barbuda's Elimination of Cervical Cancer, or ABC plan, which seeks to achieve 50% vaccination of girls between the age 9 to 13 years old by 2023, and to screen approximately 50% of women between the ages of 35 to 45 years of age, or approximately 5,500 women by 2023. This comprehensive plan includes clear guidelines on referral pathways for screening and treatment. It is hoped that there will be increased efficiency with a decrease in the time from screening to treatment. We will also establish a central cervical cancer database. A pilot project was launched earlier this month in 5 community health clinics. And to support the implementation of the project, the Ministry of Health and Wellness convened an HPV testing and treatment program, becoming the first country to implement WHO's training manual. We were able to procure HPV tests and a gene expert machine from PAHO for the project, and we extend gratitude to PAHO for its technical assistance, as well as for the equipment and supplies needed for this initiative. The pilot will establish key structures and processes necessary for a full-scale national program, and is being employed in parallel with community engagement and a communication strategy aimed at ensuring the design is fit for purpose and that uptake is optimized. The ministry has already taken steps to ensure that this pilot transitions into a permanent program offering HPV testing for all women as needed. In terms of treatment, women have access to chemotherapy free of charge, and radiotherapy services are available in country and are subsidized by the government. Palliative care is also provided in the private sector if needed. Despite the progress made, more needs to be done. We need to improve the education and information provided to women and integrate HPV vaccines into the national immunization schedule. We also need to fully establish a population-based cancer registry and increase HPV vaccine coverage. We know the report and the fact that areas of concern to us have also been identified by PAHO as areas where there have been no progress. We therefore request PAHO to intensify its assistance in these areas. This will facilitate Antigua and Barbuda's progress where there has been identified gaps and deficiencies. Thank you, Mr. President.
Thank you, Antigua, Barbuda. Canada, followed by Suriname.
Thank you, Mr. President. Canada would once again like to thank the Secretariat for this important update on the Plan of Action for Cervical Cancer Prevention and Control. It is heartening to see global action on this preventable issue, and Canada remains committed to this plan of action, as well as the global strategy to accelerate the elimination of cervical cancer as a public health problem, adopted by the World Health Assembly in 2020. This plan of action also aligns with the Sustainable Development Goals and other global commitments, such as the recently adopted WHO Global Health Sector Strategies on respectively HIV, viral hepatitis, and sexually transmitted infections for the period 2022 to 2030, which include HPV vaccination and cervical cancer screening targets. Canada would like to take this opportunity to underscore that any and all actions taken to prevent and control cervical cancer must put equity and gender equality at the forefront. These efforts must also include all people who have a cervix, including some transgender men, some non-binary people, some intersex people, and others who may not identify as women or girls. Canada continues to strongly encourage the integration of culturally responsive cervical cancer prevention and care and sexual and reproductive health services so that every woman and adolescent girl in all their diversity, as all other people with a cervix, have the opportunity to access quality cervical cancer prevention and control health services. In the future, we would encourage that these progress reports take into consideration an equity-based and inclusive approach, as well as underscore its importance in order to achieve the targets and goals outlined in the plan of action. Thank you.
Thank you, Canada. Suriname, followed by Brazil.
Thank you, Mr. President. Prevention and control of cervical cancer is very relevant for Suriname, given the fact that cancers are the second leading cause of death in Suriname, and cervical cancer is the second leading cause of cancer deaths in women. Suriname has one of the highest burden of incidence and mortality from cervical cancer in the Caribbean, with an age-standardized incidence rate of 23.7 per 100,000 and an age-standardized mortality rate of 14.1 per 100,000. In 2020, the coverage of screening of women between 30 and 49 years was only 32%, and the HPV vaccination coverage in girls up to age 15 years was 38%. PAHO supported the Ministry of Health with the development of a national plan for the prevention and control of cervical cancer for the period 21 to 30. Based on the assessment of the situation and the response, the plan identifies the following 4 strategic lines of action and strategic objectives. 1, strengthen leadership and governance in cervical cancer programming. Strengthening primary prevention through information, education, and HPV vaccination. Improve cervical cancer screening and pre-cancer treatment through innovative strategies. Improve access to services for cancer diagnosis, treatment, rehabilitation, and palliative care. These are in keeping with the global strategy and the regional plan of action. Efforts are being made to implement the national plan, especially with respect to primary prevention to the HPV vaccination, improve screening, and equitable access to treatment. Suriname was one of the first countries in the Caribbean to introduce the HPV vaccine for girls routinely in November 2013, but due to persisting mites and safety concerns, the uptake has remained low. The vaccination program offered through schools is now further challenges as parents and girls are now fearful that COVID-19 vaccine will be given to them as well or instead. This has led to an even lower coverage in 21. Suriname has not yet introduced HPV testing, but given the country's context, the expansion of coverage for screening using VIA is more appropriate at this time. While all modalities of treatment are available in Suriname, palliative care at the community or primary care level is still lacking. The country is committed to the implementation of the national plan and will continue its efforts to increase coverage for screening, vaccination, and treatment. Thank you, Mr. President.
Thank you, Suleiman. Brazil, and then Paraguay.
Good morning. Thank you very much, Mr. President. Brazil would like to express its gratitude for the progress report on the issue to be considered this morning. In keeping with the PAHO data, cervical cancer is the main cause of death amongst women in Latin America and the Caribbean. And in spite of it being highly preventable, it is still a reason for over 35,000 women who die every year in the region of the Americas. Therefore, we acknowledge the importance of continuing with our commitment in the region for prevention and control of cervical cancer as a public health problem. And we would like to express our support for the actions recommended in the report submitted. We believe that addressing this disease ought to be based on a comprehensive approach for prevention and control, and that also have multidisciplinary interventions, including components of community education, social mobilization, vaccination, tracing, treatment, and palliative care. Brazil believes that in order to control cervical cancer, access to information and the reduction of difficulties in access to health services are core issues to be guaranteed through intersectoral actions. The participation and access by the population to clear, congruent information and culturally appropriate for each territory ought to be an initiative of health services at all levels of care. In this regard, the National Cancer Institute in Brazil develops action of communication and information on health, which are used as a basis to managers for their planning of activities. Besides that, I would like to stress that last year in 2021, the Ministry of Health published a new plan of action of strategic actions in order to address chronic non-communicable diseases 2021-2030. And in 3 goals therein established, we have a 20% reduction of premature mortality caused by cervical cancer until 2030. We acknowledge the impact of the COVID-19 pandemic on access to vaccination against HPV, the Pap smear, and other services, diagnostic and oncological treatment. And we would like to stress the need for creating mechanisms, systems, and service that provide better access capable of maintaining that service during the response to public emergencies so as not to leave anyone behind. Thank you very much, sir.
Obrigado, Brazil, Paraguay, then Cuba.
Gracias, señor presidente.
Thank you very much, Mr. President. Paraguay would like to thank and take note of this report in 12, CSP 30 and 12. My delegation stresses the importance of the plan of action, whose implementation poses several challenges and opportunities, taking into account that this is one of the main causes of death in cancer affecting women in my country. In prioritizing the 4 strategic lines of the plan, we've been able to implement the activities of the National Cancer Program with the aim of reducing incidence and mortality in the population in Paraguay. Likewise, it has been used as a basis to define actions which enabled us to have the establishment of an organized program from primary prevention to tertiary treatment, including HPV as primary screening, which has been assessed by ministerial resolution. Paraguay reiterates its commitment towards the prevention and control of cervical cancer. Thus, we are adopting and adapting the global strategy for the elimination of this disease, adapting it to the national reality. However, we still face challenges amongst these budgetary challenges, where we are working intensely in order to provide better quality services. Thank you, sir.
Gracias, Paraguay, Cuba, and then Barbados.
Thank you, Mr. President. Malignant tumors constitute one of the first causes of death throughout the planet. And in Cuba, the statistics show a similar trend. In a specific way, cervical cancer is rated as the 5th cause of getting sick and dying in Cuban women. Evidence shows that sexually transmitted infection by HPV is a necessary etiological condition in more than 90% in order to develop cervical cancer and genital tract. Cervical cancer control prevention measures for cancer control in the country have achieved a dramatic reduction in mortality because of cervical cancer. And they go from education, communication, screening with the Pap smear, the guarantee of diagnosis and treatment of precancerous lesions and cancer, follow-up and palliative care. In spite of that, we maintain a trend towards a rise on incidence. And within these actions, we've depicted 2 measures recommended by WHO PAHO, included in the global strategy, in order to accelerate the elimination of cervical cancer as a global public health problem. We have not been able to implement these in the country with the introduction of the vaccine against the virus in girls from 9 to 13 years of age and the introduction of a test as a research method. currently and with the Cuban experience in producing vaccines against different viruses, we're assessing with the biotechnological industry, Aquapharma, the possibility of producing a national vaccine that will respond to this problem. In connection with the introduction of the test as a research test, we conducted a project in order to become familiar with the technology, which included representative in 3 regions of the country. Hand in hand with this, Cuba is undertaking cost-effective studies in order to propose to decision makers the inclusion of the combined test with organic cytology as a study method. In order to move progress, it is a priority. And in this regard, we're deploying concrete actions. We believe that it ought to be a possibility for cooperation that ought to be strengthened among countries in the area. Thank you very much, sir.
Gracias, Cuba, Barbados, and then Honduras.
Good morning, ladies and gentlemen. Good morning, Mr. Chairperson, distinguished colleagues. Let me begin by thanking the Director for the progress report on the Plan of Action for Cervical Cancer Prevention and Control 2018 to 2030. Barbados welcomes the support of PAHO WHO in our efforts to reduce the burden of cervical cancer. There is much to be done to improve efforts in prevention, early detection, treatment, and palliation. Given the slippage in implementation identified across the region during the COVID-19 pandemic, in this progress report, it is recommended that PAHO support countries in identifying barriers to achieve the agreed targets. It is also suggested that PAHO continue to promote opportunities for member states to share experiences and lessons learned, and to facilitate collaboration on strategies to improve cervical cancer control. Barbados welcomes the new guidance given by SAGE and WHO, offering a single-dose vaccine for the prevention of cervical cancer. We continue to have up-to-date statistics on all cancers in Barbados through the Barbados National Registry. We are pleased to note that late-stage cervical cancer rates are falling in Barbados. Barbados notes the report and encourages all members to continue to work towards the attainment of an improved country capacity for the sustained implementation of comprehensive cervical cancer prevention and control programs. Continued reporting and support by PAHO in achieving agreed targets is important to ensuring that barriers are identified early and addressed. I thank you, Chair.
Thanks, Barbados, Honduras, and Panama.
Thank you very much, Mr. President. Honduras agrees with the progress report on this plan of action for cervical cancer prevention and control. Honduras is one of the countries with the highest level of incidence and death caused by this cancer, and therefore it calls for technical and financial cooperation of WHO, PAHO, as well as the support of other agencies, so that we will be able to make sure that cervical cancer will stop being a public health problem and one of the greatest inequities for women in Honduras. In connection with the plan of action for the prevention and control of cervical cancer of PAHO, Honduras faces important challenges, and for this we need greater investment, both national as well as international cooperation. Number one, to establish a population registry of cancer that will enable us to assess incidence, prevalence, and death caused by cancer, a subsystem of a screening system and treatment in order to have country indicators on screening targets, coverage, and follow-up in women with the pre-malignant lesions in cervix. This enables us to monitor and to measure the impact of the strategic plan that will be established for the elimination of this disease. Number two, a national program for prevention and control of cervical cancer that will comply with the following: screening with an HPV test with a coverage of 70% of women in ages prioritized because of a higher risk, vaccination against HPV, expanding the range, the minimum age range in order to reach the population of girls under 15, and to establish strategies in order to reach the coverage of 90% or a nominal registry of vaccinations for their follow-up. Treatment of 90% of positive women with the pre-malignant lesions, focusing on the resolution of a treatment provided at the first level of care and an invasive cancer, improving access to diagnosis, treatment with surgery, brachytherapy, radiotherapy, chemotherapy. Palliative care for the population with cancer that so requires it. Thank you very much, sir.
Gracias, Honduras. Finally, Panama.
A very good morning to you, Mr. President. We were very pleased to receive this progress report on the Plan of Action for Cervical Cancer Prevention and Control. Panama has a comprehensive program for care for women, and we use the pap smear as a screening method. And from 19 to 30 years, we do this to home in on the risk. We include this in the screening protocol that includes a self-screening. Presently, this is the second cause of death among women in my country, and we're very well aware then that we need to boost education, awareness, prevention of this cancer, most especially in primary care workers, so that they can reach out to the women in our country. Better use of the pap smears, of course, will have a lot to do with human resources and inputs in general, because our efforts will have to be channeled towards, first of all, boosting awareness, first and last. We want human, that is personnel that is ever more aware of this, and where we can have very quick tests to let people know where they stand. We're the first country in the Americas that have offered the HPV vaccine free, and this for girls and boys under the law, under the vaccine coverage of Panama. Back in 2008, we started with little girls of 10 years and 10 and almost 11. The coverage, of course, has grown over time. Generally, our coverage is about more than 50% of women and special attention to vaccinating children. But given the pandemic, as you might imagine, that trend dropped. And we're hoping that in 22 and in 23, we can boost it up again. For the 2019-2029 program to control cancer, let me tell you that in Panama, COVID certainly impacted negatively on that work. But progressively, the country is keeping its eye on how important it is to stay on track and to keep people aware of this danger through information campaigns among the target group. We are fully committed to controlling this scourge, and we hope to do so through this very fine plan of action and various plans of prevention and control. Thank you, sir.
Gracias, Panama. Dr. Hennis.
Thank you, Mr. President, and thank you so much to the member states who have made interventions, and all the member states who have continued to work assiduously on this implementation of this plan of action for cervical cancer prevention and control 2018 to 2030. Let me acknowledge Antigua, Canada, Suriname, Brazil, Paraguay, Cuba, Barbados, Honduras, and Panama. This report presents progress after almost 4 years of implementation of the plan of action. Although highly preventable, as we've heard, through HPV vaccination, screening, and treatment, cervical cancer remains one of the leading cancers in women and responsible for an estimated 74,000 new cases and about 38,000 deaths in the Americas annually. PAHO has been providing technical cooperation on this public health matter for over 20 years. And the global strategy to eliminate cervical cancer has raised political awareness of the potential to eliminate a cancer and also to eliminate a non-communicable disease. And not if, but when we achieve elimination of cervical cancer, this will be the first entity that the world will eliminate. There's been an increase in the number of countries and territories reporting a cervical cancer screening program, with 30 countries in 2021, up from 10 in 2017. But as noted, there have been no countries that have newly initiated a cancer registry. So there are tremendous gaps that need to be addressed in this regard, particularly regarding information. HPV vaccination is included in national immunization programs in almost all countries and territories. But as noted, the COVID-19 pandemic adversely affected vaccination strategies. And as such, now, there's been no progress in the indicator for improved HPV vaccine coverage. In 2019, half the countries in the region had reached approximately 50% HPV vaccination coverage for girls aged 9 to 14, but in 2020, only a quarter of the countries had achieved at least 50% of HPV vaccine coverage. So again, a lot of areas for concern. We have to recover this space. We have to scale up the effort. Screening for cervical cancer, notably using HPV testing as the recommended testing, has not progressed well. And I will acknowledge the efforts of Antigua to do so, and we work quite close in collaboration with them and the other member states that have actually instituted HPV testing. Nonetheless, in terms of the country context where perpendicular testing is appropriate and available, again, this needs to be scaled up. Budgets have been insufficient to procure the necessary HPV tests and supplies. But there's an opportunity to update cervical cancer guidelines based on the new WHO guidelines for screening and treatment, as well as to repurpose PCR testing platforms that have been available for COVID testing towards HPV testing. And this has been achieved successfully by some of the member states. So PAHO will continue to provide technical cooperation to member states. We also know the issue raised by Canada about equity. And again, this is quite an important context that must be taken on board in terms of the technical approach to cervical cancer screening and management. So we'll continue to provide technical cooperation to ensure the targets set out in the regional plan of action are met by 2030 and to put countries on a pathway for future elimination. Thank you, Mr. President.
Thank you, Doctor. Madam Director.
Yes, after this splendid response from Dr. Hennis, I just want to take the opportunity to say how important that this is for women and girls and everybody who has a cervix, that this is given attention and really sufficient attention. And let me just remind you that this is included in the list of diseases and conditions to be eliminated. And I'm sure that saving 38,000 lives a year is very important for us, and certainly reducing the number of infections that are now standing at 74,000. So thank you for your continued interest, and let us step up this work. Thanks.
Thank you, Madam Director. As per all our items, these discussions will be reflected in the final report. Can I move to item 812B, sub-item, sorry, 812B, Plan of Action for Women's, Children's, and Adolescents Health 2018-2030, progress report, and ask Dr. Francisco Serpa to join us at the head table. And Executive Committee Rep, over to you.
Thank you, Mr. President. In the Executive Committee's consideration of the progress report, delegates supported the continued implementation of the plan of action, reaffirming their commitment to the health and rights of women, children, and adolescents. Support was also expressed for the actions proposed in the report to improve the situation in the region. Delegates welcomed the progress made thus far, but also called attention to challenges hindering the implementation of the plan of action in the region, including inequalities in access to health services, limitations in human and physical resources, restrictions on access to sexual and reproductive health services, including abortion, and longstanding challenges in the delivery of essential health services for lesbians, gay, bisexuals, trans, and other gender and sexually diverse populations. Delegates also highlighted the effect of the COVID-19 pandemic on the implementation of the plan of action, including disruptions in the delivery of health services and increases in maternal and neonatal deaths. It was considered critical to give the highest priority to essential health services that have been interrupted during the pandemic, including services to women, children, and adolescents. Thank you, Mr. President. That concludes my report on this item.
Many thanks. Could open the floor now to comments from delegates. Canada, followed by Argentina.
Thank you, Mr. President. Canada would like to take this opportunity to thank PAHO for this progress report on the Plan of Action for Women's, Children's, and Adolescents' Health 2018 to 2030. Canada fully supports the actions proposed by PAHO in this Plan of Action and continues to encourage member states to invest in evidence-based interventions to improve the situation in the region. At the Executive Committee in June, Canada encouraged PAHO to take action in encouraging member states to prioritize essential services for two-spirit, lesbian, gay, bisexual, transgender, queer, intersex, and gender and sexually diverse people. We also urge PAHO to take action in encouraging member states to prioritize inclusion of Indigenous peoples in the strategic lines of action, many of whom continue to experience deeply rooted traumas due to colonialism, such as intergenerational trauma, overt and systemic racism and discrimination, and social and economic inequalities. Canada's commitment to a renewed nation-to-nation relationship with Indigenous peoples based on recognition of rights, respect, truth, cooperation, and partnership means making high-quality and culturally relevant healthcare free from discrimination a reality for Indigenous peoples. In Canada, this also means a focus on realizing substantive equality for Indigenous children, rectifying historic harms, and supporting Indigenous-led efforts to address the impacts of intergenerational trauma. Finally, we would like to reemphasize our support for the important work of our partners who are ensuring that quality and safe sexual and reproductive health services continue to be available and accessible to all. Canada stands ready to protect advocacy efforts that promote rights for all, and especially for women, Indigenous peoples, gender diverse people, and girls. Thank you.
Thank you, Canada. Argentina, then Cuba.
Thank you, Mr. President. Argentina very much supports the implementation of the Plan of Action for Women's, Children's, and Adolescents' Health and the Altana Declaration. We believe that the rights of reproductive and sexual issues for women is a priority, not just nationally, but regionally. Argentina has been pushing for this, for equality, for non-discrimination, the eradication of discrimination based on gender, through all of the social processes, together with our normative and formative and pioneering legislation that we are passing in my country. Among the main issues, we have the law on responsible reproduction, surgical anticonception, the law of women, fathers, and children just recently born, complete sexual education, gender, prevention against gender discrimination, laws against banning abortion, and early childhood, as well as pregnancy assistance. This all, in our judgment, is basic human rights for the protection of women, children, and adolescents, and other persons who can bear children. The rights that we have offered in this domain is to us social justice, and it says everything about the need to move forward in this region, certainly also to guard against maternal mortality and neomortality. However, the blocks that we have in terms of the quality of health care is particularly urgent in the most needy areas of our population. This is why we hope that we can abide by commitments made, and we are concerned by the fact that some countries in this region appear to be moving backward with regard to basic sexual reproduction freedoms, and we urge all of the countries in the hemisphere to offer more rights to the most vulnerable populations. Let us promote a dialogue on the rights to sexual and reproductive rights, and we hope that this shall be included in the Executive Committee. Thank you.
Gracias, Argentina. Cuba, then Honduras.
Gracias, señor presidente.
Thank you, Mr. President. For Cuba, attention for women, children, and adolescents is an absolute priority. Our health policies, in fact, are very much in that direction and back it wholeheartedly. The Summit for Children and the first objective of our national plan have been met, that is to keep mortality in children below 8 children live births. We have been able to do that and keep below that 8 deaths for live births. We hope, therefore, to continue in this plan of action for women's, children's, and adolescents' health, and the program that looks at demographic dynamics pays particular attention to that cohort. Since 1980 in Cuba, there is a program for mothers and children, and all that program goes through 2030 with very careful methods and targets checked daily. Protection for women, including breastfeeding women, is very, very supported, and this goes to women, to children, boys and girls, and it works throughout the country. Throughout the country, there are 14 maternal milk banks available, and many have benefited from it. During the pandemic even, this was kept up, including the children's 2,240,000 children were seeing at the time, clinical trials, and the SECME carried out vaccination at the pediatric level and against COVID-19 between the years of 2 and 18 for children. We reached levels higher than 45% in the pediatric group. 43 different groups were set up as COVID centers that were considered suspicious or confirmed. There were 5 of them, and 28 more maternal children homes were opened at that time. We urge all member countries, sir, to look close at these policies that will make such a difference to women, children, and adolescents, because this is what will narrow the inequality among this important group. Thank you again.
Gracias, Cuba. Honduras, and then Suriname.
Thank you, Mr. President. Honduras is very much in agreement with this report on the progress report for the Plan of Action for Women, Children, and Adolescents Health 2018-2030. Our laws, our policies, our national plans and norms are all being aligned with this plan of action. So Honduras very much has taken on board the recommendations for essential health measures, helping women, children, and adolescents that were blocked or interrupted altogether over the COVID-19 pandemic. We're particularly paying attention to compiling, analysis, and better use of strategic statistics broken down by age, ethnicity, and place of or that home domicile, as these affect this cohort principally as regards indicators regarding sexual reproduction and health in general. We believe that intersectoral policies are most important in this context because this is what will allow us to better tackle ongoing inequities. It is for these reasons that with the help of PAHO, WHO, we have managed to move forward and increase our planning, our coverage with modern plans that are long-term. We're setting up measures to tackle maternal mortality. We have a national committee on surveillance of maternal death. We're checking how this can be stemmed. We are setting up a protocol of attention for victims of sexual violence, and we have updated the comprehensive standards for adolescents and are diffusing them. We also have a network of hospitals for the registry, analysis, and particular care for women regarding their sexual and reproductive rights together with HLAP. And we are also paying particular attention to mothers that are lactating. Persons, families, and communities are all taking life courses, and we have a unit on women and reproductive health is another means by which women are being paid particular attention within the health ministry. And we're trying to make more palpable the many ways that women, adolescents, and little girls in Honduras are being the center of our attention so no one's left behind. Thank you.
Gracias, Honduras, Suriname, and then Brazil.
Thank you, Mr. President. This report is useful for Suriname as a reminder of the 4 strategic lines of actions with objectives and indicators of the plan of action that the country committed to work towards achieving in 2018. It also highlights the importance of programmatic monitoring and evaluation with routine data collection and analysis and the sharing of such information internally to improve program management and externally with PAHO to contribute to the regional data and analysis for the health trends. While some efforts were made in this regard, specifically the re-establishment of the Maternal and Newborn Steering Committee, the development of the National Maternal and Newborn Health Strategy 21-25, and Operational Plan 21-23, progress has been slow in the implementation of the strategy. The Maternal Mortality Review Committee should also be revitalized to conduct regular reviews and analysis of the maternal and perinatal deaths. The country is currently working with UN partners to develop a national adolescent health policy and strategy, and plans are in place to develop a child health strategy. The integrated and intersectorial approach to maternal, newborn, child, and adolescent health should ideally be implemented. The commitment to monitoring of programmatic indicators should also be strengthened as there is limited country data since 2017. Disaggregation of the data is also important to highlight the inequities and help to inform targeted interventions toward the most vulnerable groups. For example, those Amerindian of Afro descent living in the interior. In this regard, Suriname is strengthening its information system for health, including the implementation of the perinatal information system to help streamline the data collection and analysis for monitoring and decision-making. Commitment to international reporting on indicators related to this programmatic area should also be strengthened. The plan for the renewal of the health system in Suriname will contribute to strengthening the essential health services for women, children, and adolescents that were interrupted during the COVID-19 pandemic. The strengthened human resource capacity in the Family and Community Health Department of the Bureau of Public Health should also contribute to improving the health and well-being of women, children, and adolescents. We would like to thank the PAHO Suriname Country Office that is always available to provide technical assistance and is ready to engage with national counterpart as required. Thank you, Mr. President.
Thank you, Suriname, Brazil, and then Barbados.
Thank you very much, Mr. President. We would like to thank the reports, give our thanks rather for the report that we've been looking at and to share what we think about this plan of action for women's, children's, and adolescents' health. And all of this, of course, based on our own strategy in that regard. We have, since 1988, established universal coverage, and that obviously includes women, children, and adolescents. And there is the legal protection of these three women through a special status for these. These latter date from 1990. 3 million children in 4,000 and some public and private maternity units have been born in Brazil of late. And the strategies that we have set up to fight against child mortality is very much at the core of our health policies for the last 20 plus years. We have strengthened the policies for attention to women, children, and adolescents over that time, strengthening what already existed and innovating where necessary. Some examples, the comprehensive attention to women that was launched in 2004 pays particular attention to that integral approach from the family to postpartum care. There's also the prenatal program that was launched just last June that focuses on avoiding maternal and child mortality. We have moved quite steadily down that road and acting very much in conformity, I might add, with the plan of action we have here in order to do the best we can to promote the health of women, children, and adolescents in our country. Thank you.
Obrigado, Brazil. Barbados, please.
Thank you, Mr. President. The government of Barbados acknowledges the report and is committed to the implementation of the Plan of Action for Women's, Children's, and Adolescents Health 2018 to 2030. During the post-pandemic recovery, it is crucial to give the highest priority to essential health services for women, children, and adolescents that were interrupted during the COVID-19 emergency. Member states are also urged to enhance efforts to strengthen information systems for the collection, analysis, and use of analysis and use of strategic information disaggregated by age, income, ethnicity, and place of residence in order to improve the monitoring of inequalities affecting the health of women, children, and adolescents. In addition, member states must prioritize the implementation of intersectoral policies and participation mechanisms for women and adolescents in order to effectively address persisting inequalities. Lastly, it is essential to make greater investments in evidence-based interventions in schools, families, and communities in order to enhance actions to support healthy life trajectories. The rebuilding of essential healthcare services, which have been negatively impacted by the COVID-19 pandemic, is a priority for Barbados, and all efforts will be made to regain, sustain, and surpass pre-COVID-19 achievements in women's, children, and adolescents' health. I thank you, Mr. President.
Thank you, Barbados. I have one intervention from a non-state actor. Movendi, you have the floor.
Muchas gracias, señor. Thank you very much, Mr. President. On behalf of Movendi International, we want to congratulate Pajo for this excellent report. We also want to express the concern, deep concern that we have, given the growing gap that exists in the health of women, children, and adolescents, that is not only stated here in the report, but in the work in general and through the region. Alcohol affects women, children, and adolescents most especially. But unfortunately, not enough is done to tackle these issues in the workplace. 62% of women, adult women in the Americas, find some form of problem or difficulty because of alcohol. That's a rate even higher, you may know, worldwide. Between kids 13 to 15 years, more than 30% have started drinking before 14. We know that drinking in the adolescent years leads very much to becoming an alcoholic later. And that is the second greatest burden in 10 to 24 years. Even worse, alcohol is the greatest burden for disease between 25 to 40 some years. So alcohol, it has to be said, is a major obstacle standing in the road of good health for women, children, and adolescents in the Americas. So let's not forget that we do have policies regarding alcohol that have been proven and that make a difference to those who are most vulnerable, such as increasing taxes on alcohol, introducing sensible limits to the availability of alcohol, forbid ads or sponsorships regarding alcoholic drinks. And we urge every country present here to see this as a catalyzer to boost the good health of women, children, and adolescents. Implement the SAFER technical group to promote good health and better protect women and communities that are most vulnerable, particularly and inequitably affected by alcohol. It is time that we move more conclusively on the alcohol front so that we can truly promote good health for everyone. Thank you.
Yes. Dr. Francisco Serpa, any comments?
Thank you very much, Mr. President, Madam Director, colleagues. Thank you very much to delegations of Canada, Argentina, Cuba, Honduras, Suriname, Brazil, and Barbados for their comments on this topic. When during the discussions that led to the plan of action to be adopted by member states, I think we all knew that it was a very wide-ranging area to be worked upon. And perhaps that platform of working on the health of women, children, and adolescents actually became a very powerful platform for what we are talking about, how not to leave anybody behind. And this is important because this is avoiding the fragmentations from different vertical programs for the child health, for newborn health, for maternal health, and for adolescent health. And not only that, but it does provide the platform to reduce inequities in different groups of the population, gender, age, ethnicity, among others, and also brings together subgroups of the population, such as the LGBTQI population and others. So this non-fragmentation element, I think, is what member states are actually reflecting right now in terms of the progress that has been done in the different areas of that particular platform. And we see that in this first report, 2022, of a program that goes up to 2030. And I think COVID-19 has actually shown the power of such a platform in which all of the different policies are being contributed towards. One point specifically on alcohol that was actually recent. PAHO does have a very strong technical program on alcohol and recommendations. And this is something that has been certainly an important element within this platform, as well as with other psychoactive activities, substances that were discussed yesterday. Yo quisiera agradecer.
I would like to thank
the governments that are participating here for the work that they've done in terms of state policies in order to protect the health of women, children, and adolescents within the platform that I was describing, working with the different sectors, working with education, working with development, working with promotion, because these are elements that might greatly empower the possibility of not leaving anyone behind, not only surviving, but also transforming and developing. Then the commitment that you're showing with all the actions that you've just described is essential. And we are here in the Secretariat offering for some of those areas in which no progress has been made so far, specific activities in order to continue forging ahead with this very important agenda for 2030. I believe that that is all, sir. Thank you.
Thank you, gracias. Madam Director, any comments? No comments? Thank you all. Discussions will be reflected in the final report. We can move to item 8.12, sub-item C, Plan of Action for Strengthening Information Systems for Health 2019-2023 Progress Report. Asking Dr. Sebastian Garcia Saiso to join us at the table. Executive Committee Representative, you have the floor.
Thank you, Mr. President. In the Executive Committee's discussions of the progress report, delegates reaffirmed their commitment to strengthening information systems for health, with several delegates highlighting the pivotal role of the COVID-19 pandemic and bringing to light the importance of digital tools in the response to health emergencies, accelerating the global development and implementation of such tools, and underscoring the importance of investing in public health data infrastructure and enhancing information sharing practices. It was stressed that innovations in health information systems should serve to enhance the accessibility, efficiency, and effectiveness of health services and to generate evidence for use in public health decision-making and policy development. The importance of digital health governance mechanisms was emphasized, as was the need to strengthen cybersecurity in order to protect health information systems. Thank you, Mr. President. That concludes my report on this item.
Many thanks again to any delegations for comments. I'd like to encourage delegations. We're trying to get through this agenda this morning, so I know you have 3 minutes, but if you're able to finish your remarks in less than 3 minutes, I'd be grateful. So Brazil, followed by Suriname.
I'll do my best, Mr. President. Thank you.
We would like to thank this progress report presented by the Secretariat and to highlight this, particularly currently, that the technology has been proven undoubtedly as one of the best strategies in order to move forward with strengthening information systems and access to health. Digital interoperable tools that they use, the development and use of a clinical registry system and the availability of infrastructure shall contribute to better culture of data management and obviously to improve the quality of these systems. In Brazil, we record significant progress in all these strategic lines of action proposed by the current plan of action, stressing the creation and development of National Strategy 2020-28. And the above strategy considers the 8 pillars, having the citizen at the very core and center of every process. We also developed the national network, NGAD, the development of data, national repository of COVID-19 data that brought together actions of processing, making available reporting and notification of cases, results of tests, and including the numbers of patients affected by virus. Also, something else that Brazil has been doing with new models in the supply of quality services through more collaborative and inclusive governance in such a way that digital health in Brazil will expand its reach and would bring together professional citizens, managers, and public service and private service organizations with the reliability for the benefit of all. We believe that the components that are made available on digital health provide a strategic use of the technologies in providing assistance in health and not to guarantee actions for the development of sustainable health in order to reduce inequalities and thus ensuring healthy life and to promote the well-being of the entire population. Thank you very much.
Obrigado, Brazil. Suriname, then Honduras.
Thank you, Mr. President. Suriname thanks the Secretariat for this progress report. Suriname is currently implementing several IH4H initiatives, including the introduction of standardized electronic health records and health databases, such as the Perinatal Information System and the HIS2. It is hoped that With these initiatives, Suriname will be able to improve timely access to quality information to inform programmatic and decision-making processes. The National Health Sector Reform Plan and the Health Policy Plan also prioritize IH4H. We have installed the IH4H multi-sectoral steering committee, which has been functioning well and will support a governance mechanism to further advance progress in this area. Healthcare Israel has done an assessment to make health information exchange possible in Suriname. Now the IH4H steering committee is reviewing the report to develop a plan of action for health information exchange. The list of electronic health record requirements are being updated to be implemented by December 24 through the overall health system of Suriname. Suriname is now member of Rexel network chaired by Colombia and has a voice and the opportunity to get access to digital health networking, exchange of expertise, and lesson learned. We recommend that also other member states join this network. Suriname is also engaged in telehealth projects which aims to implement telehealth facilities for the hinterlands. National legislation regarding privacy and cybersecurity needs to be adapted for the implementation of information system for health. There is a need for technical support and guidance from PAHO. We request member states to share their lessons learned during their implementation process of IH4H. Suriname takes note of this progress report and will continue to implement IH4H initiative, noting the actions that are needed for improvement and for digital transformation of the health sector. Thank you, Mr. President.
Thank you, Suriname. Honduras, then Jamaica.
Muchas gracias, señor.
Thank you very much, Mr. President. Honduras agrees with this progress report on the plan of action for strengthening information systems for health 2019-2023. This plan of action continues to be a great opportunity for Honduras to be able to develop the National Strategic Plan for Information Systems for Health in Honduras. That is so needed by our country. With the technical support of PAHO WHO, we believe that we have to go back to our plan with the 4 lines of action proposed. Little A, management and governance of information systems. Little B, data management and information technology. C, information and knowledge management. And D, innovation, integration, and convergence. This plan of action will be established and developed by the Information Management Unit of the Ministry of Health, and it is considered as a priority objective of the new Ministry of Health. Besides the line of action, management and governance of information systems will be a priority strategic line of action in order to respond to fragmentation and lack of articulation of the current system and to give strength to sustainability to the comprehensive and integral nature of the plan. Thank you very much, sir.
Gracias, Honduras. Jamaica, then Cuba.
Thank you. Jamaica notes the progress report on the PAHO Plan of Action for Strengthening Information Systems for Health 2019-2023. In this regard, we recognize the sterling and consistent support of PAHO to Jamaica, commencing with the high-level meeting for the Caribbean sub-region, which was convened in Kingston, Jamaica in November 2016. Within the next 6 years, Jamaica has made progress as follows. Strategic Line of Action 1, the Strategic IS4H Plan of Action 2017-2021 has seen completion or significant progress with 83% of the major activities. The IS4H Strategic Plan 2022-2027 is being implemented with some key activities supported primarily by an IDB investment loan. The draft digital health policy addresses the electronic health records, the electronic prescription, telehealth, and the national IS4H policy and guidelines. The PAHO maturity assessment tool was applied in 2018 and used to identify and address priority gaps. The regulatory framework for data protection is provided by the Jamaica Data Protection Act
2020, and an interinstitutional committee for IS4H has been functional since May 2019. With respect to strategic line of action 2, Jamaica has introduced standards to facilitate interoperability, including specific ISO standards, FHIR, and Open EHR. The procurement of a national EHR system is advanced and will be supported by a national unique identifier for health-driven by identifying management policy to support the EHR as well as other electronic health systems. With respect to strategic line of action 3, Mr. President, this area is not yet significantly addressed in Jamaica due to focus on investments in data governance and management and strategic information for action. Strategic line of action 4, Jamaica recently acquired an affiliate license for SNOMED in recognition of its key role as a clinical terminology for the electronic systems. We acknowledge the International Classification of Diseases system, which primarily provides classification of health data for statistical purposes. The investment in the Shared Health Records Open platform will facilitate coordination, clinical care, patients' access to their own data, and real-time reporting and analytics. The lessons learned are relevant, particularly regarding the focus firstly on information management and governance, interoperability between systems, an open approach to data models, open data, and data protection. In closing, Jamaica supports the need to continuously strengthen governance mechanisms. However, we also recognize the need to establish a sustainable program that can drive the vision and mission for IS4H and provide strategic direction and management. In this regard, the powerful principles of digital transformation for public health have provided invaluable guidance. I thank you.
Cuba, please.
Gracias, señor.
Thank you, Mr. President. We're very grateful for the elements contributed on the progress made on the 4 strategic lines of action reflected in the document and the results attained during the period. In Cuba, we have a legislative framework in connection with the principles of organization and operation of the information system of the government. In that, we find the systems that are organized in order to meet the needs for information at all levels of society and the citizen in the economic, social, demographic, geographic, environmental sphere of operation of the various units and bodies, and in others that will be decided as part of the policy for decision-making and design and follow-up of public policies that ensure economic and social development of the country. The under system of statistics information, in addition to health, is part of this system, which constitutes a strength for management and governance of IT systems for health. The implementation of digital tools for economic management, as well as epidemiological management in the process and immediate use of continuous data during COVID-19 constituted one of the main strengths in data management and the use of information technologies. Likewise, in Cuba, in the last few years, progress was made on medical robotics systems, precision, accuracy, medicine, nanoscience, and neuroscience, amongst others, which has to do with the processing and assimilating large volumes of data. The production of the information system in the different departments for medical records and health statistics, and the design of information system on web platforms that allow us to share information for decision-making in health on a timely basis is considered extremely important. Cuba trains technicians and experts in health automatization within the sector itself. This constitutes a strength in the integration for information and management of knowledge on health. Cuba is a member of several sub-regional networks for the exchange of knowledge on technological innovations, such as the Network for the Strengthening of Information Systems for Health. We believe that we ought to continue making progress and to get together as a region on these issues in order to have a more significant progress. Thank you very much, sir.
Gracias, Cuba. Last speaker, Bolivia.
Buenos días.
Good morning, Mr. President. Thank you very much for the information provided. Technological changes produced in the world and those taking place in the region, essentially on issues related to telecommunications and internet, are undeniable. The plurinational state of Bolivia has promoted the use of the new IT and communication technologies in connection with the use of electronic government focused on civil society. It is within this context that the new information system for health is including e-government tools, and within this context ought to be seen as an opportunity in order to favor and improve the conditions for development of the e-government. In the plurinational state of Bolivia, in keeping with what is provided in Law 1152 and the single information system on health, will bring together the information of all institutions in the health sector at all levels of care and management, and will be managed exclusively by the Ministry of Health and Sports. It is within this context that the design of the single information system on health will cover the public subsector, the social security short-term subsector, as well as the private subsector. It is important to stress that all efforts that are being deployed in the region in order to include the use of ICTs ought to be fully supported on the basis of PAHO. Thank you very much.
Gracias, Bolivia, and thank you all for your brief comments, and I will extend the same request to Mr. Director for any comments you'd like to make.
Thank you, Mr. President, Madam Director, delegates, colleagues. Allow me to switch to Spanish to be brief and my comments. Quiero agradecer.
I would like to thank all comments are made by member states, and above all, I'd like to thank you for the support of this initiative. And this is something that we see and hear not only in your comments, but in many of the statements made in other initiatives presented during this conference. We've highlighted the importance of having more and better data in each one of these proposals that have been analyzed into the future, and obviously the progress reports that have been submitted. And highlighting this, the value that we have with these data that need to be developed in order to have disaggregate information to truly measure the gaps that exist in health and to be able to work on the great inequalities that still persist in our region, and thus to be able to move forward towards the future. I would like to stress in particular the leadership of the countries of the Caribbean, and this was being mentioned in 2016 precisely in Kingston, Jamaica, where this initiative had begun. And from the Caribbean, then we were able to move forward towards a bigger region, and in 2019 to turn it into a plan of action that brings us all together. During this period, we've seen how member states not only have been able to bring in the IS4H initiative into their actions and national plans of health, but also operational structures within the health institutions. Today, we see with huge satisfaction countries that are developing a national units of information systems, national plans of information system for health, roadmaps, amongst other many important priority interventions, which enable us to move forward as a region in this direction. Ever since the initiative was approved in 2019, the countries and the territories of our region have made significant progress on management and governance of information system for health, in managing data, in digital solutions, in managing the information and knowledge for health, as well as in issues of innovation. And during that period, together in the region, we were able to attain the analysis of the level of maturity of information systems in the countries and territories. And this is something that has enabled us, based on these results, to develop roadmaps for interventions, and hand in hand with the strategic partners in the regional environment, as the Inter-American Development Bank and others that are precisely moving forward with you in the implementation of these plans and the construction of this roadmap into the future. There's no doubt that the COVID-19 pandemic has accelerated in a significant way the development of ICTs. And this has also been mentioned today. And that this has positioned the strengthening of information systems. It has now been positioned as one of the critical factors for the success of any health program. And in particular, in providing attention to health emergencies, but also as a priority element in building resilient health systems. And as happens in many other new areas or emerging areas within public health, obviously we need in the future to move forward with the understanding of key concepts such as interoperability, digital literacy, artificial intelligence, the Internet of Things, amongst other elements that are coming up and moving forward very quickly, and that undoubtedly will have implications in the architecture of health systems and in public health as a whole. And with this, we need to rethink our models of care, understanding the potential of digital health, to modernize our normative and legal instruments, also to facilitate access to critical data in time and format as needed, and to adjust public policies so that the progress attained so far will truly be sustainable in the future. I don't want to take any longer, but I do wish to offer a very important recognition that I address to our director, to Dr. Carissa Etienne, for this vision. In 2016, it was her who said, she said that we need to take care of this issue at the highest level. We need to create a debate at the highest level. And that is precisely what gave rise to the establishment of all these actions. So thank you, everyone. And no doubt we will continue to provide help and support with technical cooperation to move forward with this plan of action. Thank you.
Gracias. And visionary, Madam Director.
Senor Presidente, I merely want to say thank you to member states. From 2013, I had been hearing the complaints about strengthening information systems. I created the Department of Evidence and Information for Health for that very reason, and allocated resources for strength. And what I'm hearing is that we are seeing movements. We have a tool, a maturity tool that IDB is using on the basis of which they are allocating loans to member states. So we are on the move. We have to do digital transformation. We need to do digitalizing. But all of this is to better the systems for our people. So thank you very much for responding, because I was only responding to your request and your pleading. Thank you that we can do it together.
Thank you, Madam Director. Mr. Director-elect, wherever you are, hope you're paying attention. I can inform the conference discussions will be reflected in the final report. Let them move now to item 8.12, sub-item D, Plan of Action for the Elimination of Industrially Produced Trans Fatty Acids 2020-2025 midterm review. And then ask Dr. Hennis to return to the table and over to our executive committee colleague.
Thank you, Mr. President. And the executive committee's discussions of the midterm review, delegates reaffirmed their commitment to the elimination of industrially produced trans fatty acids and expressed support for the actions recommended in the progress report to improve the situation. Delegates also highlighted the link between consumption of industrially produced trans fatty acid and chronic non-communicable diseases, underscoring the need to promote healthy eating habits. The importance of information campaigns to educate the public about the risks associated with consumption of trans fatty acid was highlighted, as well as the need for warning labels with clear information on the trans fat content of foods. Delegates also underscored the crucial importance of legal and regulatory measures to regulate the use of industrially produced trans fatty acids in food productions. It was considered essential to work with the food industry with a view to eliminating partially hydrogenated oils from the food supply. Thank you, Mr. President. This concludes my report on this item.
Many thanks. Again, open the floor to delegates for any comments. Brazil, and then Jamaica.
Thank you very much, Mr. President. Brazil is strongly endeavored in protecting this protection of trans fatty, industrially produced trans fatty acids 2020-2025. Scientific evidence shows the damage caused on their health because of the industrially produced products. The consumption contributes directly to vascular inflammation and the development of cardiac diseases and cardiovascular diseases. Brazil, based on the coordination of Anvisa, the National Agency of Health Surveillance, a resolution was adopted that stipulates the prohibition of industrially produced trans fatty acids in food. The amount of trans fatty acids in refined oils will not exceed 2 grams per 100 grams of total fat. Based on January 1st, 2023, as of that date, they're banned the production and importation, use and supply of partially hydrogenated fat and oils to be used in food, as well as foods that used trans fatty acids. The Ministry of Health of Brazil has strengthened its policies and food security and nutritional programs, establishing clear guidelines for the promotion of healthy practices in order to take care of these diseases, that is to say, persistence of malnutrition and nutritional shortages and the high incidence of chronic non-communicable diseases that still persist in our countries and in the region. We are fighting for the complete elimination of industrially produced trans fatty acids and replacing them with healthy fats and oils, and we're ready to exchange successful practices and experiences with other countries in the region. Thank you.
Obrigado, Brazil, Jamaica, then Cuba.
Thank you, Mr. President. Jamaica thanks the PAHO for this comprehensive progress report. Jamaica has made progress in the implementation of the plan of action for the elimination of industrially produced trans fatty acids. Significant work needs to be done to eliminate partially hydrogenated oils from the food supply and or to limit industrial produced TFA's content to no more than 2% of the total fat in all food products. Under Strategic Action 1, Jamaica has initiated work towards the enactment of regulatory policies. A consultation was conducted in June this year with key stakeholders, including representatives from the food industry, to discuss the assessment of industrially produced trans fatty acids in Jamaica, share best practices, and discuss policy options for the elimination of trans fatty acids. The manufacturing group in September 2022 meeting expressed a willingness to work with the government towards the elimination of trans fat by 2025. To this end, a group is being constituted to develop the plan of action for the elimination of trans fatty acids, a process which the manufacturing group committed to. An expert-led workshop is also being organized for October 2022 to provide training to support this work. Under Strategic Action 2, Jamaica has not yet established or enacted policies for this. However, we are increasing our capacity at labs. Under Strategic Action 3, Jamaica conducted a national pre-regulatory assessment of the food. This study was shared with key stakeholders. Under Strategic Action 4, Jamaica has implemented education and communication strategies on the negative health impacts of TFAs and benefits of the elimination policies. Between 2021 and 2022, consultation with key stakeholders were held, including academia, food industry, media, and the general public. The reduction of risk factors for NCDs remain a priority for Jamaica. We are committed to implementing the 4 strategic lines of action and thanks PAHO for the technical support in this area. Thank you.
Thank you, Jamaica. Cuba.
Thank you, Mr. President. This plan of action that aims to eliminate industrially produced trans fatty acids and in order to set up the necessary policies for this throughout the Americas is something that Cuba very much supports. We have been promulgating Decree Law number 9, for instance, in under the rubric of nutrition that has as its aim to establish very strict regulations throughout the food chain, focusing on education, prevention, and an integral approach towards food that is not dangerous, as well as setting up a competitive and responsible involvement of the necessary entities. We want there to be increased consumer confidence, and to that end, we've set up a law on food safety and nutrition, establishing the general legal framework during which we hope that we will be able to establish food sovereignty. We also have focused on the right of every human being to have healthy and adequate food. Both of these twin actions aim at promulgating a regulatory framework, which we, of course, will continue to monitor with a view to publishing progress achieved throughout the region. That's it, sir. Thank you.
Gracias, Cuba, and finally Barbados.
Mr. President, colleague ministers, excellencies, delegates, distinguished ladies and gentlemen. Let me begin by thanking the Director General for the midterm review of Plan of Action for Elimination of Industrially Produced Trans Fatty Acids 2020 to 2025. Barbados is grateful for the support of PAHO, WHO, and CARICOM regional efforts to reduce the burden of IPTFAs. There is much to be done to advance the elimination of trans fats from the regional and local food supplies. We're also happy to have been able to be part of the efforts in CARICOM through our participation in Intergovernmental Working Group on Unhealthy Diets and Obesogenic Foods, Environments, and co-chairing of the 6th Joint COTED-COSOD meeting by the Minister of Health and Wellness of Barbados. We are awaiting Cabinet's review of a policy paper, which calls for an IPTFAs policy by December 31, 2023. This paper has supporting comments from the relevant ministries and departments, including Foreign Affairs and Foreign Trade and the Ministry of Innovation, Science and Technology. We look forward to continued support from PAHO and the regional and local efforts to protect the food supply and support the attainment of the highest level of health possible by our population. Barbados notes the report and encourages all members to continue to work towards the attainment of an improved country capacity for the sustained implementation. CARICOM has a golden opportunity to ensure that the region is TFA-free by 2024. Mr. President, thank you.
Thank you, Barbados. I have one non-state actor intervention, the International Federation of Medical Students Associations. You have the floor.
Thank you, Mr. President. Distinguished delegates, the International Federation of Medical Students Associations would like to congratulate the progress presented in the midterm review against the high mortality products such as trans fatty acids. Now more than ever, it is necessary to take a strong position to reduce non-communicable diseases. We urge the member states to increase their efforts not only to approve policies directed towards achieving the goal of the 4 strategic lines established in the Plan of Action, but to assure their implementation and publish updated and trustworthy data of their work. In addition, we make a call to action to establish mechanisms that ensure a comprehensive collaboration across sectors, including civil society organizations and the youth. Thank you.
Thank you, and thank all delegations for keeping their comments brief. Mr. Director, brief comments from you.
Thank you, Mr. President. Madam Director, member states, I acknowledge the contributions by Brazil, Jamaica, Cuba, Barbados, as well as the International Federation of Medical Students, and of course, all member states who continue to work on this plan of action for elimination of industrially produced trans fatty acids 2020-2025. As we know, there's no health value, and in fact, there's harm from industrially produced trans fatty acids. Of the 500,000 deaths that occur globally every year, 160,000 of these deaths occur in the region of the Americas. Now, more countries have enacted or started implementing the PAHO WHO best practice policies for the elimination of industrially produced trans fatty acids. So there's been a 63% increase in the proportion of the population in this region now protected from consuming this harmful substance in 2021 compared to the baseline. We acknowledge the work done by Brazil and congratulate them in that they are going to enact policies to eliminate the use of IPTFA, industrially produced trans fatty acid content, to less than 2% of total fat in all food products effective January 2023. This is what we need to achieve in every member state. We also note that while progress regarding countries and territories prohibiting the production, importation, distribution, sale, and use of partially hydrogenated oils or IP trans fatty acids in excess of 2% has been slow, there has been progress regarding countries and territories requiring standardized labeling of partially hydrogenated oils and ingredient lists. So this target has been achieved, but we've had less success regarding the use of front of package labeling. There's been little progress regarding countries adopting effective implementation and enforcement policies. And I'll acknowledge too that we work closely with the Office of the Legal Counsel of PAHO in these areas where we need to strengthen countries' technical capacity in terms of legislation and policies. So thank you, I acknowledge and thank the Office of the Legal Counsel. Member states have done better regarding national evaluation of foods containing industrially produced trans fatty acids, pre and post regulation, with progress achieved in Strategic Line of Action 3. However, a lot of work is needed by member states to create awareness of the harmful effects of industrially produced trans fatty acids and the benefits of elimination. And I thank Jamaica for its contribution to this discussion this morning. So thank you to all, and we continue to work with you to eliminate these harmful substances from human consumption. Thank you, Mr. President.
Thanks, Madam Director. Any comments? Madam Director, I think I recall the Executive Committee of 2019, where I was president, that this was the time that the plan of action was first adopted. And if I recall correctly, I think I said at the time that we should mark this moment because it's the beginning of PAHO outlawing potato chips. And then just speaking for my country, although it's impossible to outlaw potato chips, we are seeing a lot more healthy options in the potato chip aisle. So at least we can say there's some progress being made. So I'd like to inform the conference discussions will be reflected in the final report, and I'd like to move to item 8.12, sub-item E, and we'll complete this item and then take a short break. Access and rational use of strategic and high-cost medicines and other health technologies, progress report. Ask James Fitzgerald to join us again, and again to the Executive Committee representative to report.
Thank you, Mr. President. In the Executive Committee's discussions of the progress report, delegates reaffirmed their continued support for the policy on access and rational use of strategic and high-cost medicines and other health technologies, and endorse the actions proposed in the progress report to improve the situation. Delegates emphasized the importance of promoting technology transfer and local production in order to achieve self-sufficiency and thereby facilitate access to medicine and other health technologies in the region. It was also considered essential to promote market transparency and fair pricing. The need for restraint in the prescription and use of antibiotic to ensure their optimal use and avoid antimicrobial resistance was highlighted. Thank you, Mr. President. That concludes my report on this item.
Many thanks. Open the floor. I'll recognize Panama.
Thank you, Mr. President. Panama very much supports this report on the access and rational use of strategic and high-cost medicines and other health technologies. At this particular time, we are in the midst of a transition from a regular technological and policy standpoint. precisely in order to reduce the cost of essential medicines. In the regulatory context, we have proposed 10 decrees and laws. They are before the Assembly of Deputies as I speak, discussing the new law on medicines for my country. The idea is that every citizen may have access wherever they live to such medicine has been recommended to them with the prices so that everybody knows what's what and there is healthy competition. We also have a pharma law, including an element of investigation in order to sit around the table with medical producers and to see why medicine costs so much. It's unbelievable that they'll say, well, they're only focusing on the GDP when many of our countries have so much in common. And where Colombia, that's next door to us, has the same medical products being sold for a heck of a lot less. And so we're in Regional 4. We have even very similar temperature, as you know, to the neighboring countries. So it's further south, Chile and Argentina, much has been done between the two of them on their respective programs. So we're looking for help by PAHO, certainly, and frankly, from those other countries, because it's not easy. This has been a very difficult negotiation and continues to be so. We have mandated a 30% drop in medications through these 6 months, but it's not going to be sustainable. So that's the time that's been given us for the negotiation, and we're already listed in an observatory, and we have an entire roadmap. We are absolutely determined to make a difference, not only in terms of the prices, because we want to make sure that doctors are also, prescribing generics and not go to the highest priced brand available. We want Panama to receive the industries. We want to develop our own pharmaceutical market. Why not? With improved offerings on the principal ingredients. And so we really are looking for PAHO's help and a number of our friends to the south so that we can follow their good example. Thank you.
Gracias. Panama, Argentina, and then Suriname.
Thank you, Chair. Mr. President, Argentina takes very good note of this progress report on access and rational use of strategic high-cost medicines and other health technologies. We believe that in order to overcome these difficulties that are really linked to technology, we need from all quarters effort in order to produce locally doctors, pharmaceuticals, vaccines, and therefore we very much support this report. We think it comes at a very good time. And as the document properly says, together with PAHO and WHO, Argentina set up the second forum on this very point, looking at the supply chain and cost as a major challenge, not only regionally, but worldwide. And so we are very much behind the strategy and WHO's support on the intellectual property through 2030. We are also very much in support of all other actors that are interested in moving forward here in a transparent way through the use of that mechanism. And what Panama just stated leads me to say, please know, Panama, that Argentina stands absolutely ready to help you or any other country in the region. Count on it. Thank you.
Gracias, Argentina, Suriname, then Honduras.
Thank you, Mr. President. Access to strategic high-cost medicines and other technologies continues to be a challenge for the health system in Suriname due to cost and the relatively low quantities needed, among other things. Policies and procedures that support the accurate demand forecasting, procurement, ongoing monitoring, evaluation, and the rational use of medicines and other health technologies are in need of strengthening. The improved use of the PAHO Strategic Fund will assist in ensure high-quality medicines and health technologies, even with low quantities required by Suriname. Putting in place a strong regulatory system for the incorporation, evaluation, and rational use of MHGs is also a priority of the Ministry of Health Suriname, and the re-establishment of the National Regulatory Committee will help to advance progress in this area. Suriname takes note of this report and will continue its efforts to implement the policy and to work with PAHO and other stakeholders to identify areas of possible collaboration and support to strengthen access and regional use of strategic high-cost medicines and other technologies. Thank you, Mr. President.
Thank you, Suriname. Honduras, then Brazil.
Muchas gracias, señor.
Thank you very much, Mr. President. Honduras very much agrees with this progress report on access and rational use of strategic and high-cost medicines, as well as other health technologies. It is of the utmost importance that this policy document continue to be implemented at all levels of action, both nationally, as well as sub-regionally and regionally. We are very interested indeed in moving forward in such strategies as the evaluation of health technologies, the exchange of information, and proper information on the training necessary. All of these mechanisms at the regional and sub-regional joint levels, as well as initiatives with regard to regulatory processes, are to the good. We feel that the Pan American Health Organization and WHO itself here plays a very key role in terms of facilitating and assisting us in moving forward. Thank you.
Gracias, Honduras. Brazil.
Thank you, Chair. President, Brazil has really moved forward and quite significantly with regard to the access and rational use of strategic and high-cost medicines and other health technologies. Despite the enormous size of our country and various epidemiological challenges, as you may know, we have really emphasized how important it is to make sure that new technologies and bringing down the high cost and frankly, production in our countries moves forward. We are really, I believe, pushing for the pharmaceutical industry to frankly understand that program. And all of this, of course, to everyone's good, as is internationally and nationally recognized. We look very carefully at our essential medicines. We periodically check our list. We have also the OPAS, we have PAHO's own structure in terms of safe and validated medicine. We've set up a health bank. We've established a regulatory table on medicines and a very close monitoring of strategic inputs for the health sector, and we participate regularly on the establishment of fair pricing. There are a number of private-public partnerships, and we use this as a strategy to ensure that the production of drugs, high-cost medicines, and other technologies are fair and duly inspired from, as necessary, the market abroad. We wish, of course, to be sure that vaccines, diagnostics, and other medical products are available, particularly in times of a pandemic, keeping up to date on the technology. The call to action within PAHO is important to us. And I would simply underscore that in 2021, almost 216 million reais were allocated in Brazil to face the particular challenges of the COVID pandemic and to assist at the pharmaceutical level. We also have a committee to promote the rational use of medicine. it is positive, it is pro-positive, it is strategic, and we look to see how the use of medicine can fit into the best and most rational health framework in our country. We thank PAHO for its support here for this report and so many others with regard to strategic and high-cost medicines. And we certainly underscore our own willingness to continue to support this as well as other technologies in the Americas. Thank you.
Obrigado, Brazil. Mr. Director, over to you.
Thank you very much, Mr. President. And thank you to all the member states for your comments on this report. As I mentioned yesterday, one of the principal drivers in expenditure in health at the moment is medicines and health technologies. I think we're all seeing that across the region. And one of the principal areas of concern in terms of out-of-pocket expenditures in healthcare relates specifically to the issue of medicines and technologies, which is increasing at a faster rate than any other, particularly in terms of services, any other component of out-of-pocket expenditures. And so this issue of access to medicines continues to really be a priority area of work, I think, for all of us, both secretariat and countries, as we move forward. This report is closely linked to what we have already discussed around strengthening regulatory systems, and of course the discussion we had on the importance of using evidence-based processes to guide decisions for health technology assessment. But I think there's an important issue that also the report raises, and it's how a fragmented approach to the issue of medicines is essentially being taken across the region, where countries are specifically working either on regulatory issues or access and use or health technology assessment or procurement, the various subcomponents without a real holistic approach, a policy approach, as was very well highlighted by the delegate from Panama, that is really required to address the complexity of issues that ultimately impact availability, access, and affordability. The approach, therefore, should really focus on the complete elements and functions of the policy cycle, from selection based on best evidence, the use of essential medicines, rational use strategies, strategies to really strengthen services, increase pricing transparency, and linked with that then the regulatory strengthening component that will support the rapid introduction of generic medicines in the region. In a recent report that we produced by the Secretariat, we did note that generic penetration in Latin America and the Caribbean is only 30% of that we see in the United States. The United States being a reference in terms of the use of generic medicines within the healthcare system. Only 30%, which means we have a lot more work to do to really effectively regulate generic medicines and then ensure their integration, deployment, and as Panama again mentioned, the practices that are required to support prescribing of generic medicines within health systems. But regulation doesn't stop just in quality. We also have to look at the intellectual property frameworks and the other regulations that often impact procurement processes, which in turn will result in favorable conditions or not for access. And so it's this policy, it's the collective approach that is really required, and this is what the report is urging. Thank you to Honduras. We will continue to really support and the implementation strategies around this, and we will, of course, Panama, come back to you jointly with Argentina and other countries from the south to have and support this integrated approach that's really required in the area of access to medicines. Thank you very much.
Thanks, James. Madam Senior Director, any comments?
No, I think this was very well said. Thank you very much.
I call my bosses the grand poobahs, so you're the grand poobah. Okay, look, that takes us to the end. I'd like to indicate discussions on this item will be reflected in the final report. We'll take a short break, 15 minutes only, please. And we'll come to our last substantive item, 8-8.13, recall I said yesterday that we will take A, B, C all together. And I'll give a bit more time for delegations to be able to speak to all three items at once. So reconvene no later than 11:15. Thank you.
The nationally determined contributions, NDCs, meet the commitments made by countries to face climate change. They include adaptation to climate change and mitigation actions, the reduction of greenhouse gas emissions and other atmospheric pollutants. Their implementation brings about benefits: reduction of the number of deaths, number and length of stay in hospitals, number of sick leaves, and respiratory and cardiovascular disease cases related to the quality of the air, among other consequences for the public health system, the companies, and the state. In order to quantify the benefits brought about by NDCs, the World Health Organization developed a tool called Carbon H. Carbon H allows legislators, voters, decision makers, and entrepreneurs to have the information they need on the expected effects on health of the enhancement of the air quality. The NDC, as prepared by Colombia, encompasses 148 measures aimed at reducing greenhouse gas emissions by 51% by the year 2030, as compared to 2014. By using the Carbon H tool, it is estimated that some of the health co-benefits of implementing the NDCs are avoiding 25,600 deaths over the period 2021 to 2030, and 3,800 per year after 2030. As of 2030, 2,750 cases of hospitalization per year caused by respiratory and cardiovascular disorders will be avoided, reducing 892,000 asthma episodes in children per year after the year 2030. This represents economic benefits for the public health system of up to $12.9 billion during the period 2021 to 2030, and of $1.8 billion per year, or the equivalent of 0.64% of GDP, as of the year 2030. Carbon H is free of charge for countries, and PAHO is committed to providing the necessary technical cooperation to make the most of it by adding the healthcare costs and tangible figures to the climate actions. You're the only one missing. Visit www.paho.org and get acquainted with the experiences, applications, and possibilities offered by Carbon H.
Hello, Paula.
Buenos dias.
Bom dia.
O que você gostaria de falar hoje?
Hola.
Oi.
Hi, I'm Paula. I'm the Pan American Health Organization's first digital health specialist on alcohol use.
Why we developed Paola? The COVID-19 pandemic amplified two chronic problems we've had with alcohol. One is misinformation on the internet and social media, and the other is the limited health professional capacity to deal with alcohol problems in the health system. Therefore, the pandemic accelerated the need for a trusted and reliable source of information to improve health literacy related to alcohol, as well as to help people assess their risk and decide on a change plan towards a healthier lifestyle.
What or who is Paola, and why do you think we need her?
I was built to provide reliable information about the impact alcohol can have on your health. I want to help reduce your risk of harm from alcohol use.
Ter álcool pode causar câncer?
Há uma forte ligação entre o álcool e as doenças crônicas, particularmente o câncer.
How can I make sure I drink responsibly?
I'm sorry to say, but there's no such thing as responsible drinking.
¿Cómo sé si estoy bebiendo demasiado?
Puedo ayudarte a evaluar si lo que bebes puede causarte daños.
Paola is a conversational agent created by Barro, the first in the world dedicated to alcohol topics. She's built with artificial intelligence and the latest scientific information on hundreds of alcohol-related topics. Paola speaks English, Portuguese, and Spanish to an unlimited number of users, 24 hours per day, 7 days a week, in a way that is totally anonymous, confidential, and free to the user. She can be reached by mobile phone, desktop, tablet, or other similar device.
Why a digital health specialist for this obviously really important function? What was your decision there?
Paola can answer your questions on alcohol and health or alcohol-related harms, can screen for your alcohol risk, and guide you towards a change or quit plan. She can also refer users to treatment resources in their own country. Paola is empathetic, engaging, her conversations are anonymous and non-judgmental. The capacity of digital people is enormous to reach more people where they are at a minimal or no cost. It can reduce the workload of health professionals and give them more time to talk to their patients when necessary. Compared to mass campaigns of education or education in schools, digital solutions like Paola have the potential to be so much more cost-effective.
Provokes in humans a limbic system response, if you like. So you can retain more information and you can do it for longer.
Paola is completely innovative, but is based on established evidence-based principles.
In fact, artificial intelligence has become the new frontier in health.
Technology designed to improve knowledge, promote health with personalized, non-judgmental engagement, and ultimately to save life.
It is a great step forward.
Think you could benefit from drinking less?
I know I would. Can you please help me?
I'd love to help you. And I promise I won't judge. I'm a digital person after all. I don't know how to judge.
The Americas, a dynamic region full of diversity, and yet the most unequal in the world. 201 million people still live in poverty. Illnesses such as obesity, diabetes, hypertension, and high cholesterol are more prevalent among poor and vulnerable populations. The mortality rate is twice as high for children under 5 with undereducated mothers. And every year, 2 million babies are born to mothers between the ages of 15 and 19. It is our duty to protect those who are most in need. We will do whatever is necessary to ensure that no one is left behind. We've been doing so for over a century, and we're not going to stop now. Because our determination doesn't stop. Our dedication doesn't stop. Our commitment to our communities doesn't stop. And because life doesn't stop. Health is the most precious resource we have and an engine of sustainable development. It helps to close gaps and reduce inequalities. Investing in resilient healthcare systems is vital for their recovery and preparation for the future. However, no single nation or organization can tackle the health challenges facing the Americas alone. We are the partner of choice to promote public health and the best resource to improve the quality of life in our communities. We provide coverage in all countries, management and supervision of projects at the regional and national level, knowledge and networks in all areas of healthcare, capacity to convene people, mechanisms of transparency, and experience with responding to emergencies. Building partnerships has been essential to improving healthcare in the region. Life expectancy has increased by 36 years. The mortality rate for children under 5 has been reduced by 67%. Hundreds of millions of people have been able to get vaccinated and obtain access to medicines. Smallpox, polio, rubeola, and measles have been eradicated. Each of these achievements demonstrates what can be attained through collaboration. And yet, we still have much work to do. Many people's lives depend on us. Let us continue working together to bring health and hope to every corner of the Americas. The Pan American Health Organization.
There is a silent threat we can confront and beat when empowered with information. Around 57% of cases of liver cirrhosis and 78% of liver cancer worldwide are caused by infections, which in turn are caused by hepatitis B or C viruses. These viruses may produce an inflammation of the liver. Some of the common symptoms are fever, nausea, vomiting, abdominal pain, skin rash, jaundice, loss of appetite. However, in most cases, symptoms caused by the virus do not show for years until the disease becomes chronic. Knowledge is power. Moreover, in order to prevent the spread, we must bear in mind that both hepatitis B and C are transmitted by contact with infected blood due to unprotected sexual relations, mother-to-newborn contact during delivery, sharing needles, and other personal and intimate objects. A vaccine against hepatitis B is available for people of all ages. A single dose administered to a baby within 24 hours of delivery, followed by a comprehensive vaccination plan during the first 12 months of the child, may avoid transmission of the virus from an infected mother to her child. A routine vaccination plan for children and adults belonging to groups at risk, such as healthcare workers, is the best way of achieving immunity for the population from hepatitis B. In the case of hepatitis C, there is no vaccine to prevent contagion, but there are treatments that cure the infection for good, thus avoiding complications and transmission to others. Remember, knowledge is power. That's why, ask for a hepatitis B vaccine for your baby. Practice safe sex. Do not share syringes, needles, or other objects that may contain contaminated blood. And last but not least, go get tested. Do not hesitate to get a test in order to have a hepatitis diagnosis. If we act mindfully, we may achieve our goal to eradicate viral hepatitis in the Americas by the year 2030.
tecnologías perinatales elaboradas por el CLAP son herramientas que permiten acompañar el cuidado de las mujeres embarazadas en el periodo prenatal, durante el trabajo de parto y en el parto, así como en el control de los recién nacidos. Son instrumentos de bajo costo y de alto impacto en la atención primaria de salud, pero también lo son para especialistas que asisten a niveles de mayor complejidad.
Son fáciles de utilizar, de interpretar, trasladar y facilitan la atención oportuna tanto de las gestantes como de los recién nacidos.
Esto conecto y la cita, me voy a tener en el campo y yo controlo el embarazo.
Al calendario obstétrico se le agregaron medidas de algunos parámetros seleccionados que permiten calcular la menorrea, vigilar el crecimiento y la vitalidad fetal y estimar la edad del embarazo, la edad del recién nacido y verificar la normalidad del incremento del peso materno, de la presión arterial y la contractilidad uterina, entre otros parámetros. Este disco permite detectar casos con restricción del crecimiento fetal o macrosomía fetal, alteraciones de la duración del embarazo o una contractilidad mayor a la correspondiente a la edad gestacional. Además, si se desconoce la fecha de la última menstruación, nos permite estimar la menorrea a partir de las medidas ecográficas embriofetales. A partir de la semana 20 se presentan los valores de percentiles 10 y 90 del peso fetal y el percentil 50 de la talla correspondiente a cada semana.
La cinta obstétrica se utiliza para medir la altura uterina durante el embarazo. Permite controlar el crecimiento fetal y recordar los patrones para la vigilancia de la salud materno-fetal.
El estetoscopio fetal ilustrado tiene figuras sobre la técnica de ocultación y registro de patrones normales y desaceleración de la frecuencia cardíaca fetal a partir de la semana 20 de gestación, asociada a las contracciones uterinas en el embarazo y parto. De esto depende su interpretación y las recomendaciones. El estetoscopio de Pinard, a diferencia de otros métodos, tiene la ventaja de no necesitar baterías, dispositivos que a menudo faltan en los lugares de atención.
¿Cómo, perdón?
¿Cómo le vas a llamar?
Emma.
Emma, el último nombre de la.
El dilatómetro es una herramienta que nos sirve como una plantilla para ir viendo el grado de dilatación y de esa forma entrenarnos para la correcta valoración del trabajo de parto. Como podemos ver, se va dividiendo por centímetros, que es la manera como nosotros vamos valorando la evolución normal de un trabajo de parto, y lo hacemos mediante la introducción de nuestros dedos para tener un estimado de la dilatación. Por ejemplo, la dilatación de 2 centímetros nos cabería la introducción de un solo dedo, o la de 10 centímetros cuando podemos abrir al máximo nuestros dedos acá.
La cinta neonatal es una cinta métrica diseñada para medir el perímetro cefálico del recién nacido al momento del nacimiento y a las 24 horas si fuera necesario confirmar la medida. En el anverso tenemos impresa una escala de 55 centímetros con divisiones entre centímetros y milímetros. En el reverso contiene los valores correspondientes a -2 y -3 desvío estándar para el perímetro craneano para una edad gestacional conocida para niños y niñas desde las 27 semanas hasta las 42 semanas de edad gestacional. También en el reverso se encuentran los valores normales correspondientes a -2 y -3 desvío estándar de perímetro craneano para niños y niñas de término. Esta tecnología ha sido de gran utilidad para vigilar el síndrome congénito posiblemente asociado al virus del Zika. Este instrumento es de fundamental utilidad para nosotros, los neonatólogos, y en general el seguimiento del recién nacido, dado que podemos obtener información clara y precisa acompañado de un instrumento que es fácil de utilizar, nos facilita la valoración de nuestros pacientes.
Although you may not feel it, it's here. The air we breathe is a right. Nine out of 10 people live in cities where air pollution levels are above those recommended by the World Health Organization. Air pollution knows of no borders. It is a global issue, causing inflammation of our airways, cardiovascular diseases, neurodegenerative diseases, preterm births, and skin aging. And it kills almost 7 million people every year. We may reduce pollution levels by demanding laws that limit the emission of gases and particles, by using clean means of transportation, providing for a good disposal of waste products, by opting for energy efficiency. You are part of the solution.
Aging opens up a world of possibility. The possibility of continuing to do what we love and be who we are. But without the right support, aging can also bring limitations. Poor health, vulnerability, loneliness. We believe that a safe, caring, and supportive environment can turn aging into an opportunity to be healthy, to live fully, to embrace change, and keep learning and developing. We believe all people have the right to thrive at any age, adding dignity to years, well-being to years, life to years. It's the decade of healthy aging in the Americas, adding life to years.
A região está diante de uma iminente crise pela considerável diminuição do número de crianças que recebem todas as vacinas. Em 2021, nas Américas, 2,7 milhões de crianças com menos de um ano não receberam ou completaram seus esquemas vacinais básicos devido às interrupções nos serviços de saúde ocasionadas pela pandemia da Covid-19. A pandemia também afetou a vigilância destas doenças e os sistemas de laboratório. A região poderia não ser capaz de detectar o próximo surto de uma doença prevenível por vacinação antes que ela se torne uma epidemia multinacional. Pela íntima relação entre epidemias e a vida em sociedade, estamos não somente ante a um risco sanitário, mas também ante a um risco econômico, educacional e social. Precisamos diminuir o risco de importação e de surtos de doenças que foram eliminadas das Américas, como a poliomielite, a rubéola e o tétano neonatal. Para conseguir isso, os Estados-membros, os parceiros e a Organização Pan-Americana da Saúde devem trabalhar em conjunto para fortalecer todos os aspectos dos programas de imunização, investindo recursos financeiros e aumentando a quantidade de pessoas capacitadas que possam garantir serviços de imunização e sua integração ao sistema de atendimento primário da saúde.
Isto somente vai ocorrer se os governos e os sócios se comprometerem, política e economicamente, a fechar as lacunas na imunização. Como principal colaborador da região em todas as questões de saúde pública, a OPAS está perfeitamente posicionada para ajudar os Estados-membros a priorizar suas necessidades mais urgentes e implementar ações a favor da vacinação. Continuemos com nossa exitosa colaboração para fortalecer os programas nacionais de imunização em toda a região. É possível superar esta crise. Juntos, triunfamos no passado e voltaremos a triunfar. Organização Pan-Americana da Saúde, 120 anos. Somos a Organização Pan-Americana da Saúde. Comemoramos 120 anos de solidariedade na promoção da saúde e bem-estar das pessoas, sem deixar ninguém para trás.
Bom dia outra vez. Bem-vindos.
Good morning again. Welcome back.
Parece que temos quórum. Super. Eu vejo a movimento em Haiti, pero
I see movement around the seat from Haiti. I see the US taking a seat.
Excellent. Thank you, Monica. First of all, let me apologize for dressing down. It's a bit like Superman getting in a phone booth, changing clothes, but I'm not Superman by any stretch. But I had to check out, so that's why I had to get changed, since I didn't want to change clothes in public. Okay, we are down to our final substantive item. 8.13. Resolutions and other actions of intergovernmental organizations of interest to the Pan American Health Organization. We have 3 sub-items here, and again, as I mentioned earlier, we will be taking them not consecutively, but all together. And as a result of that, we have 3 colleagues from the Sanitary Bureau who will be at the head table. Monica, of course, is one of them. Ms. Mariana Faria is a second one. And Dr. Gottfried, I really don't know how to pronounce it. Schweb. Okay. Dr. Gottfried, wherever you are, you could join us as well. And I'll ask representative of the executive committee if he can speak to each element at the one after the other before we open the floor. So over to you.
Thank you, Mr. President. A, 75th World Health Assembly. The Executive Committee received a report in June on the resolutions and other actions of the 75th World Health Assembly and of various sub-regional bodies considered to be of interest to PAHO. The committee was informed that the text of the resolutions and decisions adopted by the Health Assembly had not been published at the time that the report was prepared, and that a full analysis of the matters of particular interest to the region would be provided and the report to be submitted to the present Pan American Sanitary Conference. This concludes the report on this item. I will continue to the next. That's 8.13C, sub-regional organizations. With regard to the report on actions of sub-regional organizations, the Executive Committee was informed that the main aim of PAHO's work at the sub-regional level is to ensure that health issues remain on high-level political agendas in the region. To that end, the Bureau has taken steps to strengthen the 3 sub-regional coordination offices. The Executive Committee's discussions of the report, it was pointed out that sub-regional integration organizations have an important role to play in facilitating sub-regional participation and encouraging consensus in various global processes underway within WHO, including the working group on strengthening WHO preparedness and response to health emergencies, and the discussions on possible amendments to the international health regulations and on new WHO instrument on pandemic preparedness, prevention, preparedness, and response. Thank you, Mr. President. That concludes my report on these items.
Many thanks, colleague. And I think we have Monica, Mariana, and Godfrey here. So they're all available to answer any comments that the floor wishes to make on any or all of these 3 items. So I open the floor. Who would like to speak to these items? This is your last chance. Thank you, Argentina. You have the floor.
Thank you, Mr. President. Argentina takes very good note of this report, and we very much note the importance of CELAC and Mercosur among the sub-regional organizations. We also note that the ministers of health of Mercosur have gotten together and looked at the health plan for UNASUR and the response to medical emergencies, as well as past experience as a response to COVID. We also note the meeting of the CFC, the International Health Regulation, and how important all of this is with regard to the working group of strengthening of WHO, the negotiation body, the intergovernmental negotiating body, and the international health regulations. All of this is of the utmost importance, we consider, and we exhort the rest of the countries to get together and arrive at a joint and common position to strengthen the region of the Americas in this regard. As to CELAC, we underscore the importance of the health programs in the Caribbean and in South America to boost the actions taken in the region by forging a position of solidarity among our countries. Argentina has particular priority on vaccines produced in Latin America and the Caribbean, and the regional distribution of vaccines, diagnosis, and treatment for COVID, as well as other diseases, through the implementation of self-sufficient in the health field. We also accord the greatest priority to these working groups together with PAHO, so that our sub-region can continue going from strength to strength and be duly represented regionally and globally. Thank you.
Gracias, Argentina. Any other delegations wishing to speak on this? 3 items, 3 sub-items. What do you say this? Going once? Going twice? I think we've all had a long week, and I think we're all at the end. So I will not take silence as being disinterest, and I hope colleagues in the Secretariat notice that as well. I think I would like to invite, so would each of you like to make a few comments? Godfrey, over to you.
Thank you, Mr. President. I hope can I call you Mr. President, or is it Your Excellency or Your Honorable?
Any works for me. Yeah.
Thank you, Mr. President. Thank you to the delegate of Argentina for that important comment and for giving us the opportunity to also speak on this item. As you heard from the Executive Committee's report, one of the things that we've done as the Secretariat, Dr. Etienne has strengthened the role of the sub-regional offices of PAHO. We have 3 sub-regional offices, 1 for South America, 1 for Central America, and 1 for the Caribbean, with the aim of actually, as the delegate of Argentina said, to strengthen the health initiatives within those sub-regional entities, within the integration mechanisms, but also more importantly to work with the pro-tempore presidencies to set the agenda of the heads of government of the integration mechanisms, to not only discuss health, but also more importantly, as we go along and come out of the pandemic, to discuss the social and other determinants of health, and to ensure that health remains high on the agenda of the presidencies and of these integration mechanisms. So thank you, Argentina, again, and thank you all the member states for all the support and cooperation in the integration mechanisms. Thank you, Mr. Chair.
Many thanks, Godfrey. Liana, anything? Monica, anything to add? We're good? Okay. So that brings us, thank you, all 3 of you, for making yourselves available. We're now down to our last item. Any other matters? Item 9. And I think I turn to Madam Director to see if there's any other matters you'd like to bring to the attention of the conference.
No, no, Mr. President, no other matters. Thanks.
This is your last hurrah, you know.
I still have to do my closing.
Oh yeah, you're closing. That's right. You got closing remarks. Saves it for the end, of course. Do any delegates have any other matters that they'd like to bring to the attention of the conference. I recognize the United States.
Thank you, Mr. Chairman and Mr. President, rather. On behalf of the United States of America, I would just like to congratulate all the delegates on a very lively and productive Pan-American Sanitary Conference, and to let our great director Etienne know that we have appreciated her service for the last 10 years and love her dearly and are going to miss her. And we want to thank our Deputy Director, Lou Valdez, for her incredible work over these past many years, and the entire PAHO leadership team. Thank you so much.
Many thanks, U.S., for those kind words to the Secretariat. Any other delegates wish to bring any other items to the table? Seeing none, I think we can move now to our final item, closure of the session. And one more time, Director, Madam Director, you have the floor.
Monsieur le Président, thank you very much. Let me also recognize our distinguished delegates and member states, participating states or associated member states and observers. Also our distinguished guests, my colleagues and distinguished ladies and gentlemen. So thank you, Maro. I think you wanted to bring a little tears to my eye, but I dried all of them up, so there are none left. Let me greet all of you on the closing of what has been a truly inspiring and productive week of frank discussions, transparent deliberations, and far-reaching decisions. I really thank you for the engaging manner in which you participated at this conference. Is Jabas here? Let me again congratulate Dr. Jabas, and let me assure you, all of you, that my full and unequivocal support will be given to the director-elect as he prepares to take the mantle of the office as PAHO's 11th director in February 2023. Our in-person gathering this week has been an important milestone as we turn the corner on what has been the devastating COVID-19 pandemic and pursue a path towards recovery and reconstruction. I do hope that we have now broken the cycle of mandatory pandemic-induced virtual meetings. This being my last conference as a director of PAHO, I am especially grateful for the formal and informal opportunities that we had to be together this week. When the Directing Council convenes in 2023, delegations will once again be able to enjoy the comfort and the convenience of modernized and enhanced conferencing facilities at PAHO's headquarters on 23rd Street Northwest. And thank you for your patience and your endurance of being not at your home for this conference. Permit me to take this opportunity to extend to the peoples of Cuba and the United States of America our deepest condolences for the loss of lives and the tremendous destruction of property, including health facilities, wrought by Hurricane Ian. Our prayers and thoughts are with you. This week, we discussed and adopted many important policy decisions, among them resolutions to accelerate the region's post-pandemic recovery, to recommit to addressing the social determinants of health, and to elevate the mental health and substance abuse crisis as a regional priority that must be addressed. I heard renewed commitments to genuinely address cross-cutting issues, to close equity gaps, to remove barriers to health for people living in situations of vulnerability, to take those actions necessary for delivering integrated care and to apply intersectoral approaches for improved health outcomes. Your renewed calls for regional solidarity and recommitment to the values of Pan-Americanism, equity, solidarity, and fairness were explicit and I dare say unambiguous. Your acknowledgement that the region's health workforce had borne the brunt of the COVID-19 fight was further amplified by appeals for refreshed and concerted efforts to develop, retain, and reward health workers, especially those at the first level of care. I do appreciate your emphasis for the Bureau's continued prudent management of resources, your calls for pragmatic solutions to problems, and for the payment of quota contributions and reducing the arrears. Let me also, and allow me to reiterate that PAHO, the Secretariat, needs your assessed contributions. Thanks for including the important and timely agenda item on maintaining the region of the Americas free of polio. Thank you also for acknowledging the 10-year track record of unqualified audits during my tenure as director. We in the Secretariat have indeed worked hard to firmly embed accountability, transparency, ethics, and rigorous management of the organization's resources in the very culture and practice of the Secretariat. Ladies and gentlemen, we have lived through the toughest of times, but there are yet formidable challenges ahead. If we ever doubted it, the pandemic has demonstrated yet again that the creation of PAHO some 120 years ago was an act of incredible foresight. Each successive generation has reinforced and added building blocks for achieving health for all, drawing on past lessons and expanding possibilities through new knowledge, better data, health innovations, new technologies, and an undaunted human spirit to do more and to do better. Who knew in 2017, as I accepted a second term as director of PAHO, that my greatest challenges as a leader were yet to come? You have recognized that interactions at the human, animal, and environmental interfaces can trigger major crises. And you have restated your support for the One Health comprehensive, multi-sectoral, multi-stakeholder approach. This week, we discussed and adopted 13 resolutions and covered several key topics. Thank you very much for challenging each other during this conference to do whatever is necessary to reduce inequities and improve people's health and lives by bridging the gap between commitments and action. Today, as I prepare to lower the curtain on my tenure as director of PAHO and to hand over the leadership reins to my successor, I am encouraged to observe a new generation of leaders emerging across the region. Many of you are in this room or participating virtually in the conference. Your talent, your skills, energy, and ingenuity will without doubt be equal to the challenges that lay ahead. You give me optimism about the future of PAHO and health for all in the Americas. In closing, and on behalf of all of us, I would first like to record our deep appreciation to the respective presidents of Dominica and Argentina, and to the Secretary of Health for the U.S. Department of Health and Human Services for their wise opening remarks, which set the stage and tone for the remainder of the meeting. I would also like to convey our special thanks to Mr. President Mike Pearson of Canada for his skillful management of this 30th Pan American Sanitary Conference, for his interjections of good humor, and thank you, Mr. Pearson, for getting us there on time. With time to spare. Let me also thank the President of the Executive Committee, Minister Visotti of Argentina, and our rapporteur from Uruguay, who both discharged their respective functions with diligence and excellence. Let me also thank let me also thank Suriname, who has deputized for Minister Visoti. I also wish to record our collective thanks to the Deputy Director, Mrs. Mary Lou Valdez, for her easy graciousness as Secretary of this conference. To our governing body's office for their efficient planning, management, and execution of this conference under the competent leadership of Monica Zakari Davoli. You would not have guessed that there was so many added complexities and the planning to execute this. It seemed almost seamless. To the directors and staff of the technical and enabling departments for enduring the rigorous process to ensure good documents and presentations. To the staff of our departments of communications, information technology, and our general service office for their expert support and multifaceted contributions. To other members of the executive management for your unstinting support and guidance during this conference, but way beyond that. To legal counsel and their staff for the exceptional management of the election process in accordance to the highest standards of transparency and integrity. And to all the personnel of the Secretariat for their sterling contributions, their tireless efforts, and their magnanimous support both during this week and in the preceding preparatory period. I wish to add my personal word of thanks to my Chief of Staff, Dr. Merle Lewis, and the hardworking, really industrious team in the Director's Office. I am very grateful for your continued support, your love, and your care. And on behalf of all the delegates, I want to extend a wholehearted thank you to our talented interpreters who make it possible to understand each other. Else we would have been in the Tower of Babel.
Thank you on behalf of the interpreters.
So, ladies and gentlemen, I assure you that I will continue to give of my very best to PAHO until Dr. Jabas assumes the position in 2023. Thank you for your many kind words and your acts of generosity to me during this conference, but throughout my tenure of 10 years. We couldn't do it without the support and commitment of all of our member states. Thank you for allowing me to work alongside you. I encourage everyone with a vision and big dreams to make this world a better place, to continue to reach up and up and up beyond your grasp. You will be surprised at what is possible. And it has been really for me an undisputable honor for me to serve the people of the Americas as the director of PAHO. I feel privileged yet humbled that you trust me, and it has reaped good results. I wish you au revoir, safe travels, and Godspeed as you return to your respective homes. With profound thanks.
So Carissa, I gave you flowers once, but we're giving you flowers again. This time in a big jar.
Thank you so much.
A heavy jar, so there you go.
I'll take it home to my mama.
Many thanks, Carissa. I noticed that you did not miss one final opportunity to ask for everybody to give their assessed contributions. And I respect that, among all the other many great things that you said. Before I close the conference, Lou, I have an announcement from you, so please go ahead.
Yes, thank you, Mr. President. One announcement. We would like to remind delegates that the 171st session of the Executive Committee will take place in this room starting at 2 p.m. All delegates are welcome to attend this session. The Executive Committee members are Argentina, Bolivia, Brazil, Chile, Cuba, Jamaica, Suriname, United States of America, and Uruguay. Thank you, Mr. President.
So, Mr. President, before the final gavel, I want to give you your personal gavel.
Thank you. Can I take it out and use it as?
You don't want to break it though.
My notes say bang the hammer. So, but just before I do that with this one, not this one, I want to just echo, frankly, many of the things that Carissa said. I want to start with our interpreters as well. It's a fantastic job that they've done over the 3.5 years that I've been coming to PAHO meetings. I hear the familiar voices every time. They do a fantastic job keeping up with everybody. And I just want an additional sort of reflection from the president about how much I value, and we all value their contribution. So one more applause for interpreters.
Thank you again, Mr. President, from all of us. Thank you so much.
Teresa, you mentioned many members of the Secretariat, and there are many members of the Secretariat who made this conference a success. And I want to just again echo your comments in that regard and your thanks, including the senior leadership with you, like Lou and Heidi and Monica and many others as well. Many others here at the front who have helped me to make sure I could remember who had to speak next. That was really very important and helpful to me. And again, I want to echo you in thanking our rapporteur or tours, or it's our one rapporteur and our 2 executive committee representatives who so effectively did their jobs this week. And one other group that I think we often don't mention or recognize, but have an equally important and a very silent job, which is our guards. At the entrance, at the other entrance, always checking to make sure that you have legitimate access to be here. They do a great job. They're great people, and just want to offer my thanks to their contributions as well. And Madam Director and Director-elect Dr. Yarbas, particularly to Director-elect Yarbas, remember that we, as part of this week's events, decided and announced that Madam Director would become Director Emeritus of the Pan American Health Organization, and that maybe that'll be more than just a title. You will have constant opportunity, I am sure, to continue and be welcomed at any time to continue to participate and to be part of this family. Not looking over the shoulder of your successor, but offering him the sage advice that I know you will be able to do on an ongoing basis, not just over the transition period. And I know he will welcome your contributions. So it's been an honor to serve as your president. Very much enjoyed the experience and enjoyed working with all of you. And on that, I will declare the session closed. Here we go.
I have a box for you.
Oh, great.
Michael, I just, I'm sorry to have you yelled at me. I didn't mean that.
No, no, no. Guys.
That's just my
you're a
job.
fantastic champion. Yeah.
Thank you so much.
Yes, you make it all happen.
Can I have a picture with you?
Yes, of course. You want someone to take it?
Give me a hug. I didn't yell at you though. I yelled at Michael.
What stories you gonna tell us?
Scenes. In 2021, 2.7 million children.
See you next time.
We'll see.
Thank you very much.
Thank you.
Also affected the surveillance of these diseases and the health systems.
I hope I'll be back in the headquarters.
Due to the close relationship between regions and the right society, we are not only facing problems, but also in economic, education, and social. Despite measures to reduce the risk of importation of complex diseases that have been eliminated from the Americas, such as polio, rubella, and neonatal disease. To achieve this, member states, partners, and the Pan American Health Organization must work together to strengthen all aspects of immunization programs by investing financial resources and increasing the number of trained staff who can ensure immunization services and incorporation into the primary healthcare system. Just the governments and partners make the political and financial commitment to closing immunization gaps. The Pan American Health Organization, the region's main partner of all public health members, is perfectly positioned to help member states prioritize their most urgent needs and implement actions to support vaccination. Let us continue our successful collaboration to strengthen national immunization programs throughout the region. Together, it is possible to overcome this crisis. We have succeeded in the past, and we will do it again. Pan American Health Organization, 120 years. We are the Pan American Health Organization, celebrating 120 years of solidarity in advancing health and well-being, leaving no one behind.
Las Américas, una región dinámica y diversa, pero también la más desigual del mundo. 201 millones de personas todavía viven en la pobreza. Enfermedades como la obesidad, la diabetes, la hipertensión y el colesterol alto son más prevalentes entre los pobres y los más vulnerables. La mortalidad de niños menores de 5 años es el doble cuando las madres tienen menor educación. Y cada año nacen 2 millones de niños de madres entre 15 y 19 años. Tenemos el deber de proteger a quienes más lo precisan. Haremos lo que sea necesario para que nadie quede atrás. Lo hemos hecho por más de un siglo y no vamos a parar. Porque nuestra determinación no para. Nuestra dedicación no para. Nuestro compromiso con las comunidades no para. Porque la vida no para. La salud es el recurso más valioso y un motor del desarrollo sostenible. Ayuda a cerrar brechas y a eliminar inequidades. Invertir en sistemas de salud resilientes es vital para la recuperación y la preparación para el futuro. Pero ninguna organización o nación puede abordar los desafíos de salud en las Américas por sí sola. Somos el socio de elección para promover la salud pública y el mejor instrumento para mejorar la calidad de vida de nuestras poblaciones. Tenemos cobertura en todos los países, capacidad de gestión y monitoreo de proyectos a nivel regional y nacional, conocimiento y redes en todas las áreas de salud, capacidad para convocar, mecanismos de transparencia y experiencia en dar respuestas a emergencias. Las alianzas han sido esenciales para mejorar la salud en la región. La esperanza de vida aumentó 36 años. Las muertes de niños menores de 5 años se redujeron un 67%. Miles de millones de personas se han podido vacunar y acceder a medicamentos. Se eliminó la viruela, la poliomielitis, la rubéola y el sarampión. Cada éxito demuestra lo que la colaboración puede lograr. Pero todavía queda mucho por hacer. Las vidas de muchas personas dependen de nosotros. Llevemos juntos salud y esperanza a cada rincón de las Américas. Organización Panamericana de la Salud.
Vaccination Week in the Americas have been celebrated for 20 years. It's an annual celebration that aims to promote equity and access to vaccination for all people, no matter where they live or their socioeconomic situation. Everybody has the right to health, to vaccines, and to a healthier life.
Porque las vacunas salvan vidas.
Aunque estemos en COVID, la vacunación no para, la vacunación continúa.
Cada año y en solo una semana, este empuje sin igual por la salud, liderado por los países y apoyado por la Organización Panamericana de la Salud, logra vacunar alrededor de 50 millones de personas.
El desafío es grande porque nos trazamos metas.
A principal dificuldade são as distâncias.
Que los niños de nuestro país no vayan a morir por una enfermedad prevenible.
La forma de llegar a la casa y llegarle al usuario es muy importante.
Y se espera con ansia.
Hoy en día sé que es importante la vacuna.
Es muy importante vacunar a nuestros niños para el bien de nuestra familia.
Me tomo el tiempo de llevar a mi hijo a vacunar. Eso se llama responsabilidad y tenerle amor a sus hijos.
Cada uno de nosotros puede hacer algo. Tenemos que hacer nuestra parte.
Es lo más lindo que me pasó. Hago con mucho cariño, con mucho empeño mi trabajo y me gusta mucho.
Eu me sinto muito honrada de trabalhar, porque eu sei que é programa que você tem resultado.
La salud no espera. Vacunémonos.
Vacúnate. Uno todos los días está luchando para que nuestra población esté sana.
Por el bien de todos, en las Américas y en el mundo.
Las vacunas son muy seguras y efectivas. Esta iniciativa se ha convertido en un ejemplo magnífico de lo que puede suceder cuando los países trabajan juntos.
Sabemos que una población sana es una garantía para un país fuerte.
Vaccination Week in the Americas demonstrates the political commitment of countries toward their immunization programs. Thanks to the joint efforts of more than 40 countries and their partners. In the past 20 years, more than 1 billion people have been vaccinated during Vaccination Week in the Americas, and different diseases have been eradicated in our region. Thanks to health workers, people in every corner get vaccinated. Today, we celebrate 20 years of Vaccination Week in the Americas. Are you fully vaccinated? Get all your shots.
Naka, Unguita, Ispich.
¿Sabía que 1/3 de los presupuestos de salud se destina a la compra de medicamentos? Altos costos, calidad insuficiente y productos poco disponibles en el mercado, además, pueden representar una carga extra para los presupuestos de salud y amenazar la sostenibilidad del sistema. Por eso, y a pedido de los países de las Américas, la Organización Panamericana de la Salud creó el Fondo Estratégico en el año 2000. El fondo es un mecanismo solidario para la compra conjunta de medicamentos e insumos de salud pública de calidad. Consolida la demanda de múltiples países, convoca a licitaciones internacionales y obtiene precios reducidos al adquirir grandes volúmenes del mismo producto. También apoya a los países para mejorar la planificación de la demanda y evitar desabastecimientos. ¿Qué productos se pueden adquirir? Más de 250, desde tratamientos para diversas enfermedades, transmisibles, no transmisibles y desatendidas, hasta equipos médicos, insumos y kits de diagnóstico. El Fondo Estratégico ofrece líneas de créditos a los países que lo necesiten a través de su cuenta de capitalización. El uso del fondo genera ahorros en los presupuestos de salud. En solo un año, un país ahorró $13 millones en la compra de medicamentos para VIH-Sida y tuberculosis. Todos los productos adquiridos a través del fondo son seguros, eficaces y de calidad garantizada. Para utilizar el fondo, los países, a través de sus ministerios de salud, deben firmar un convenio con la OPS. ¿Por qué hacerlo? Porque más y mejor acceso a medicamentos e insumos es clave para garantizar la salud para todas las personas en todas partes. Para conocer más, ingrese a www.pajo.org/Fondo Estratégico.
Hello, Paula.
Buenos días.
Bom dia.
Hola.
Oi.
Buenos dias.
Oi.
É um prazer te conhecer. O que você gostaria de falar hoje?
Beber álcool pode causar câncer?
Há uma forte ligação entre o álcool e as doenças crônicas, particularmente o câncer.
How can I make sure I drink responsibly?
I'm sorry to say, but there's no such thing as responsible drinking.
¿Cómo sé si estoy bebiendo demasiado?
Puedo ayudarte a evaluar si lo que bebes puede causarte daños.
Hi, I'm Paula. I'm the Pan American Health Organization's first digital health specialist on alcohol use. I was built to provide reliable information about the impact alcohol can have on your health. I can also help you check if your drinking is putting your health at risk and guide you through a plan to cut back. Do you think you could benefit from drinking less?
I know I would. Can you please help me?
I'd love to help you. And I promise I won't judge. I'm a digital person after all. I don't know how to judge.
Desde que iniciou o surto de sarampo no estado do Amapá, essa vacinação vem sendo realizada com muito empenho, com várias frentes de vacinação, principalmente na capital e nos municípios onde nós tivemos casos. Então, nós organizamos na forma de varredura, de vacinação casa a casa, estratégias em escolas, em creches.
Teve o caso de sarampo de uma criança da creche, a gente veio oportunizar também, a gente veio verificar as cadernetas das crianças, encontramos muitas cadernetas desatualizadas, então o foco também foi esse, a gente fazer essas vacinas de rotina, atualizar e também priorizar a vacinação da tríplice viral, sarampo, né?
A varredura vacinal é uma ação que a equipe de saúde vai até a população, batendo na casa e perguntando quem mora, qual a faixa etária e revisando o cartão de vacinação. A partir da revisão do cartão de vacinação é ofertada a vacina que esteja faltando para completar o esquema de vacinação daquela pessoa e atualizando toda a caderneta, não só de uma pessoa, mas de todos os residentes daquela casa.
Para a gente foi muito importante essas ações de varredura, principalmente com relação ao sarampo. Imagina, de 2019 para esse ano de 2022, a gente tinha 200 casos de sarampo. Então, a gente conseguiu controlar o surto de sarampo com essas ações, de modo que hoje a gente tem entre 10 e 12 casos.
Você acha que é importante você tomar vacina? Por quê?
Porque é ótima para nossa vida e nos livrar de todos os vermes e proteger as nossas famílias.
everyone, my name is Michael Phillips, and we turn this busy highway every Sunday into a place of exercise. So I got the concept for that program from my experiences in traveling as a national cyclist. Doing a training ride, I saw someone walking on the shoulder of the highway, and then I thought to myself, why is this person walking on the shoulder of the highway? Then I realized in the area there were not many green spaces or areas designated to sport or recreational activity.
Well, I've been coming here basically every Sunday for years. It's kind of my Sunday morning ritual. So very appreciative to have a good space without the traffic, without having to worry about cars.
It was really important and interesting to see all of the activities taking place.
There were people cycling, there were people obviously walking, there was somebody with their dog. There was a lot of not just physical activity, but social activity.
One of the important things that came out of it as far as recognition is that the government actually made it an act of parliament that road is closed specifically for exercise on a Sunday morning in that area. And I think that's the only program of its kind in the Caribbean still, given that kind of recognition.
I come because I feel safe, you know, as they close down the highway, because we get to ride in a safe area.
My motivation is starting an exercise program and recognizing there was a need for it, but also the fact that there was going to be such great community interaction.
I know that this is a particular session that's held in the northwestern part of the country, but we need this to go out to the villages, to Pinal, to Toco.
If we were going to scout for individuals to be able to duplicate this, it's a strong sense of passion and understanding that you have to be devoted to this.
I have been fortunate to be a part of this program since 2009, which is 13 years ago. And one of the really, really wonderful benefits is bringing my son out to learn to ride from a very young age of 3.
Many people have said that they felt that that program had saved their lives. I've seen people come there as couples and walking every Sunday morning, and then, you know, a spouse passes away, and then the community that's there on Sunday morning is that support group for that individual.
Well, we do this almost every Sunday. So I personally look forward to it. It builds good discipline. So it's not only fitness, it's a whole lifestyle package.
During the course of the COVID-19 pandemic, one of the things that was very clear, that those persons who had non-communicable diseases like hypertension and diabetes and cancer and these kinds of things, were the ones that succumbed the first to COVID-19. So it is really important that we focus on our health all year round.
Well, let's start with the fact that focusing on your own personal health is part of being a good citizen.
Michael Phillips would have approached the NWRHA to come and partner today for screening such as BMI, blood pressure testing.
I went and do my cholesterol, blood test and so on, and everything is normal. What it told me is to keep it up.
It's really about balance, and it's ensuring that you're taking care of your mental, your physical, and your emotional health.
I want to encourage people to go to POWER website, go to the NWRHA website, including the Ministry of Health, to get more information about lifestyle and other diseases.
This is our neighborhood.
Our neighborhood.
Our neighborhood.
Our neighborhood.
Our neighborhood, our health.
Keep moving, get healthy now.
Porque yo creo todavía en lo que es el amor por la gente, el amor por la persona, el amor por el otro. Cuando uno ayuda con el tema de la salud, es porque se trata de algo clave para la vida, ¿no? De estar sano. ¿Cómo no apoyar algo que para mí es muy importante? Si yo tengo la posibilidad de parte mía de hacer algo que pueda ayudar a alguien a acercarse a la salud, a mí me enorgullece, me deja feliz de poder llegar a un niño o a cualquier otra persona. Lo vivo así y lo siento así, por eso uno lo hace también. Ver la reacción de ellos, ¿no? Que muchas veces uno siente que también tiene muchas cosas para aportar y para dar, no solamente dentro de la cancha de fútbol. Son cosas realmente importantes, son cosas que te quedan y que después te las recordás siempre. Son cosas lindas, la verdad. En el fútbol he dado siempre lo mejor de mí. ¿Y qué le puedo dejar a la gente? Eso, de que el fútbol es como la vida. Tenés que en las cosas que hacer, hacerlo con el corazón, dar todo. Me parece más que una actitud, una responsabilidad frente a la vida. Una responsabilidad que tenemos que tener nosotros de ocuparnos de muchas áreas de nuestra vida que son fundamentales para poder tener una vida saludable. Yo colaboro con OPS por una cuestión de un poco mi forma de ser también, ¿no? Apostar a llegar a aquella parte de la población, de la sociedad un poco más necesitada. Hablar de salud es tratar de buscar la mejor forma de vivir. el tema de las vacunas, y creo que en esta época de pandemia se ha hablado mucho, ¿no? Hemos vivido siempre vacunándonos. Es algo que para mí es salud. Entonces, por eso es que uno tiene la motivación y las ganas de querer apoyar, porque soy muy así. Trato de lo que siento y lo que pienso que para mí es algo bueno, hacerlo, sin importarme lo que pueda ser un comentario, lo que se pueda decir. Estamos todo el tiempo peleando, ¿no? Si es blanco, para otros es negro. Si la vacuna hace bien, para otros hace muy mal. Hay que confiar en la gente que ha salvado muchas vidas. Y hay que confiar en la gente que trabaja y se prepara para protegernos y cuidarnos. Es así al final de cuentas. Es confiar en el que sabe. A mí me pasó después de un partido de fútbol, ¿tá? que fue clave, que fue importante en lo que fue un poco mi carrera, que me marcó mucho y me sobrecargué de responsabilidad en ese momento. Lo que me tocó vivir a mí, que fue un poco un tema de ansiedad, mucha ansiedad, que te desestabiliza mucho y no me dejaba dormir y era increíble. Y en ese momento uno se preguntaba, ¿pero por qué? ¿No? ¿Pero por qué? ¿Pero por qué? Bueno, te lo puede explicar alguien que realmente puede haber estudiado, que puede haberse preparado para poder explicártelo a veces por qué pasan ciertas cosas. Esa es la salud mental. Es saber que somos seres humanos como todo el mundo y que vamos a tener problemas y que podemos tener problemas y que podemos sentirnos mal y que podemos llorar y que podemos perder y que después vamos a ganar. El ser fuerte para afrontar ciertas situaciones está bien, pero no creerse a veces un superhéroe de que yo todo puedo aguantar y que yo todo puedo hacer y que yo todo puedo lograr. Para mí, el rol que juega la familia en lo que es la cabeza y la salud de una persona es fundamental. Y la familia es la que te acompaña y la familia es la que sufre. Es donde te cobijas muchas veces también cuando las cosas por ahí no funcionan. La familia y aquellos amigos es un poco la vida.
Health is the most precious resource we have and an engine of sustainable development. It helps to close gaps and reduce inequalities. Investing in resilient healthcare systems is vital for their recovery and preparation for the future. However, no single nation or organization can tackle the health challenges facing the Americas alone. We are the partner of choice to promote public health and the best resource to improve the quality of life in our communities. We provide coverage in all countries, management and supervision of projects at the regional and national level, knowledge and networks in all areas of healthcare, capacity to convene people, mechanisms of transparency, and experience with responding to emergencies. Building partnerships has been essential to improving healthcare in the region. Life expectancy has increased by 36 years. The mortality rate for children under 5 has been reduced by 67%. Hundreds of millions of people have been able to get vaccinated and obtain access to medicines. Smallpox, polio, rubeola, and measles have been eradicated. Each of these achievements demonstrates what can be attained through collaboration. And yet, we still have much work to do. Many people's lives depend on us. Let us continue working together to bring health and hope to every corner of the Americas. The Pan American Health Organization.
Uite, uiar mi, uiar hara.
Did you know that 1/3 of health budgets are used to purchase medicines? High costs, insufficient quality, and hard-to-source products in the market are major barriers to access medicines and threaten the sustainability of the system. For this reason, and at the request of the countries of the Americas, the Pan American Health Organization in 2000 created the Strategic Fund. The fund is a mechanism for pooled procurement of quality medicines and public health supplies. It pools the demand of multiple countries, executes international tenders, and achieves reduced prices when purchasing large volumes of the same product. It also supports countries to improve demand planning and prevent stockouts of medicines and health supplies. What products can be purchased? More than 250, from treatments for various diseases, communicable diseases, non-communicable diseases, and neglected diseases, to medical devices, supplies, and diagnostic kits. The Strategic Fund provides lines of credit for countries when needed through its capital account. The use of the fund allows savings in health budgets. In just 1 year, one country saved $13 million in the procurement of medicines for HIV/AIDS and tuberculosis. All products procured through the Strategic Fund are safe, effective, and quality assured. To use the fund, countries, through their ministries of health, need to sign an agreement with PAHO. Why do this? Because improving access to medicines and supplies is key to guaranteeing health for all, everywhere. To learn more, visit www.paho.org/strategic fund.
Hello, Paula.
Buenos días.
Bom dia.
Hola.
Oi.
Buenos dias.
Oi.
É um prazer te conhecer. O que você gostaria de falar hoje?
Beber álcool pode causar câncer?
Há uma forte ligação entre o álcool e as doenças crônicas, particularmente o câncer.
How can I make sure I drink responsibly?
I'm sorry to say, but there's no such thing as responsible drinking.
¿Cómo sé si estoy bebiendo demasiado?
Puedo ayudarte a evaluar si lo que bebes puede causarte daños.
Olá, o meu nome é Paola. Eu sou a primeira especialista digital em saúde e consumo de álcool da Organização Pan-Americana da Saúde. Fui criada para fornecer informação confiável sobre o impacto que o álcool pode ter na sua saúde. Também posso te ajudar a entender se o seu consumo de álcool está colocando a sua saúde em risco e guiá-lo em um plano para reduzi-lo. Você acha que beber menos poderia te beneficiar?
Tenho certeza. Por favor, você pode me ajudar?
Também gostaria de te ajudar. E prometo que não vou te julgar ou criticar. Afinal, sou uma pessoa digital. Eu não sei julgar.
I am.
We are.
All of us. Together.
This is who we are.
Our humanity. The hopes we share.
The struggles we face.
The stories that define us.
Individually, collectively, universally.
Every person.
Family.
Community.
We are happier when we have each other.
Healthier when we stand together.
Every one of us matters.
No one should be left behind.
We all have the same fundamental right
to health and happiness.
To the care we need.
Wherever we live.
Whatever we have or do not have.
Regardless of age.
Race.
Language.
Culture or circumstance.
This is our mission.
We stand together with all people.
In every community, every country, throughout the hemisphere.
Because we are healthier.
Together.
We are the Pan American Health Organization, working for health for everyone, everywhere.
The region is facing an imminent crisis due to the significant decrease in the number of children who receive all vaccines. In 2021 in the Americas, 2.7 million children under 1 did not receive nor complete their essential vaccination schedule because of the interruptions in health services caused by the COVID-19 pandemic. The pandemic also affected the surveillance of these diseases and the laboratory systems. the region may be unable to detect the next disease outbreak that could have been prevented by vaccination before becoming a multinational epidemic. Due to the close relationship between epidemics and life in society, we are not only facing a health risk, but also an economic, educational, and social one. It is crucial to reduce the risk of importation and outbreaks of diseases that have been eliminated from the Americas, such as polio, rubella, or neonatal tetanus. To achieve this, member states, partners, and the Pan American Health Organization must work together to strengthen all aspects of immunization programs by investing financial resources and increasing the number of trained staff who can ensure immunization services and their incorporation into the primary healthcare system. This will only happen if governments and partners make the political and financial commitment of closing immunization gaps. The Pan American Health Organization, the region's main partner in all public health matters, is perfectly positioned to help member states prioritize their most urgent needs and implement actions to support vaccination. Let us continue with our successful collaboration to strengthen national immunization programs throughout the region. Together, it is possible to overcome this crisis. We have succeeded in the past, and we will do it again. Pan American Health Organization, 120 years. We are the Pan American Health Organization, celebrating 120 years of solidarity in advancing health and well-being, leaving no one behind.
Las Américas, una región dinámica y diversa, pero también la más desigual del mundo. 201 millones de personas todavía viven en la pobreza. Enfermedades como la obesidad, la diabetes, la hipertensión y el colesterol alto son más prevalentes entre los pobres y los más vulnerables. La mortalidad de niños menores de 5 años es el doble cuando las madres tienen menor educación. Y cada año nacen 2 millones de niños de madres entre 15 y 19 años. Tenemos el deber de proteger a quienes más lo precisan. Haremos lo que sea necesario para que nadie quede atrás. Lo hemos hecho por más de un siglo y no vamos a parar, porque nuestra determinación no para. Nuestra dedicación no para. Nuestro compromiso con las comunidades no para. Porque la vida no para. La salud es el recurso más valioso y un motor del desarrollo sostenible. Ayuda a cerrar brechas y a eliminar inequidades. Invertir en sistemas de salud resilientes es vital para la recuperación y la preparación para el futuro. Pero ninguna organización o nación puede abordar los desafíos de salud en las Américas por sí sola. Somos el socio de elección para promover la salud pública y el mejor instrumento para mejorar la calidad de vida de nuestras poblaciones. Tenemos cobertura en todos los países, capacidad de gestión y monitoreo de proyectos a nivel regional y nacional, conocimiento y redes en todas las áreas de salud, capacidad para convocar, mecanismos de transparencia y experiencia en dar respuestas a emergencias. Las alianzas han sido esenciales para mejorar la salud en la región. La esperanza de vida aumentó 36 años. Las muertes de niños menores de 5 años se redujeron un 67%. Miles de millones de personas se han podido vacunar y acceder a medicamentos. Se eliminó la viruela, la poliomielitis, la rubéola y el sarampión. Cada éxito demuestra lo que la colaboración puede lograr. Pero todavía queda mucho por hacer. Las vidas de muchas personas dependen de nosotros. Llevemos juntos salud y esperanza a cada rincón de las Américas. Organización Panamericana de la Salud.
Vaccination Week in the Americas have been celebrated for 20 years. It's an annual celebration that aims to promote equity and access to vaccination for all people, no matter where they live or their socioeconomic situation. Everybody has the right to health, to vaccines, and to a healthier life.
Porque las vacunas salvan vidas.
Aunque estemos en COVID, la vacunación no para, la vacunación continúa.
Cada año y en solo una semana, este empuje sin igual por la salud, liderado por los países y apoyado por la Organización Panamericana de la Salud, logra vacunar alrededor de 50 millones de personas.
El desafío es grande porque nos trazamos metas.
A principal dificuldade são as distâncias.
Que los niños de nuestro país no vayan a morir por una enfermedad prevenible.
La forma de llegar a la casa y llegarle al usuario es muy importante.
Y se espera con ansia.
Hoy en día sé que es importante la vacuna.
Es muy importante vacunar a nuestros niños para el bien de nuestra familia.
Me tomo el tiempo de llevar a mi hijo a vacunar. Eso se llama responsabilidad y tenerle amor a sus hijos.
Cada uno de nosotros puede hacer algo. Tenemos que hacer nuestra parte.
Es lo más lindo que me pasó. Hago con mucho cariño, con mucho empeño mi trabajo y me gusta mucho.
Eu me sinto muito honrada de trabalhar, porque eu sei que é programa que você tem resultado.
La salud no espera. Vacunémonos.
Vacúnate. Uno todos los días está luchando para que nuestra población esté sana.
Por el bien de todos, en las Américas y en el mundo,
las vacunas son muy seguras y efectivas. Esta iniciativa se ha convertido en un ejemplo magnífico de lo que puede suceder cuando los países trabajan juntos.
Sabemos que una población sana es una garantía para un país fuerte.
Vaccination Week in the Americas demonstrates the political commitment of countries toward the immunization programs. Thanks to the joint efforts of more than 40 countries and their partners. In the past 20 years, more than 1 billion people have been vaccinated during Vaccination Week in the Americas, and different diseases have been eradicated in our region. Thanks to health workers, people in every corner get vaccinated. Today, we celebrate 20 years of Vaccination Week in the Americas. Are you fully vaccinated? Get all your shots.
¿Sabía que 1/3 de los presupuestos de salud se destina a la compra de medicamentos?
Altos costos, calidad insuficiente y productos poco disponibles en el mercado, además, pueden representar una carga extra para los presupuestos de salud y amenazar la sostenibilidad del sistema. Por eso, y a pedido de los países de las Américas, la Organización Panamericana de la Salud creó el Fondo Estratégico en el año 2000. El fondo es un mecanismo solidario para la compra conjunta de medicamentos e insumos de salud pública de calidad. Consolida la demanda de múltiples países, convoca a licitaciones internacionales y obtiene precios reducidos al adquirir grandes volúmenes del mismo producto. También apoya a los países para mejorar la planificación de la demanda y evitar desabastecimientos. ¿Qué productos se pueden adquirir? Más de 250, desde tratamientos para diversas enfermedades, transmisibles, no transmisibles y desatendidas, hasta equipos médicos, insumos y kits de diagnóstico. El Fondo Estratégico ofrece líneas de créditos a los países que lo necesiten a través de su cuenta de capitalización. El uso del fondo genera ahorros en los presupuestos de salud. En solo un año, un país ahorró $13 millones en la compra de medicamentos para VIH-Sida y tuberculosis. Todos los productos adquiridos a través del fondo son seguros, eficaces y de calidad garantizada. Para utilizar el fondo, los países, a través de sus ministerios de salud, deben firmar un convenio con la OPS. ¿Por qué hacerlo? Porque más y mejor acceso a medicamentos e insumos es clave para garantizar la salud para todas las personas en todas partes. Para conocer más, ingrese a www.pajo.org/Fondo Estratégico.
Hello, Paula.
Buenos días.
Bom dia.
Hola.
Oi. Buenos dias.
Oi.
É um prazer te conhecer. O que você gostaria de falar hoje?
Beber álcool pode causar câncer?
Há uma forte ligação entre o álcool e as doenças crônicas, particularmente o câncer.
How can I make sure I drink responsibly?
I'm sorry to say, but there's no such thing as responsible drinking.
¿Cómo sé si estoy bebiendo demasiado?
Puedo ayudarte a evaluar si lo que bebes puede causarte daños.
Hi, I'm Paula. I'm the Pan American Health Organization's first digital health specialist on alcohol use. I was built to provide reliable information about the impact alcohol can have on your health. I can also help you check if your drinking is putting your health at risk and guide you through a plan to cut back. Do you think you could benefit from drinking less?
I know I would. Can you please help me?
I'd love to help you. And I promise I won't judge. I'm a digital person after all. I don't know how to judge.
Desde que iniciou o surto de sarampo no estado do Amapá, essa vacinação vem sendo realizada com muito empenho, com várias frentes de vacinação, principalmente na capital e nos municípios onde nós tivemos casos. Então, nós organizamos na forma de varredura, vacinação casa a casa, estratégias em escolas, em creches.
Teve o caso de sarampo de uma criança da creche, a gente veio oportunizar também, a gente veio verificar as cadernetas das crianças, encontramos muitas cadernetas desatualizadas, então o foco também foi esse, a gente fazer essas vacinas de rotina, atualizar e também priorizar a vacinação da tríplice viral, sarampo, né?
A varredura vacinal é uma ação que a equipe de saúde vai até a população, batendo na casa e perguntando quem mora, qual a faixa etária e revisando o cartão de vacinação. A partir da revisão do cartão de vacinação é ofertada a vacina que esteja faltando para completar o esquema de vacinação daquela pessoa e atualizando toda a caderneta, não só de uma pessoa, mas de todos os residentes daquela casa.
Para a gente foi muito importante essas ações de varredura, principalmente com relação ao sarampo. Imagina, de 2019 para esse ano de 2022, a gente tinha 200 casos de sarampo. Então, a gente conseguiu controlar o surto de sarampo com essas ações, de modo que hoje a gente tem entre 10 e 12 casos.
Você acha que é importante você tomar vacina? Por quê?
Porque é ótima para nossa vida e nos livrar de todos os vermes e proteger as nossas famílias.
everyone, my name is Michael Phillips, and we turn this busy highway every Sunday into a place of exercise. So I got the concept for that program from my experiences in traveling as a national cyclist. Doing a training ride, I saw someone walking on the shoulder of the highway, and then I thought to myself, why is this person walking on the shoulder of the highway? Then I realized in the area there were not many green spaces or areas designated to sport or recreational activity.
Well, I've been coming here basically every Sunday for years. It's kind of my Sunday morning ritual. So very appreciative to have a good space without the traffic, without having to worry about cars.
It was really important and interesting to see all of the activities taking place.
There were people cycling, there were people obviously walking, there was somebody with their dog. There was a lot of not just physical activity, but social activity.
One of the important things that came out of it as far as recognition is that the government actually made an act of parliament that road is closed specifically for exercise on a Sunday morning in that area. And I think that's the only program of its kind in the Caribbean still, given that kind of recognition.
I come because I feel safe, as they close down the highway, because we get to ride in a safe area.
My motivation is starting an exercise program and recognizing there was a need for it, but also the fact that there was going to be such great community interaction.
I know that this is a particular session that's held in the northwestern part of the country, but we need this to go out to the villages, to Pinal, to Toco.
If we were going to scout for individuals to be able to duplicate this, it's a strong sense of passion and understanding that you have to be devoted to this.
I have been fortunate to be a part of this program since 2009, which is 13 years ago. And one of the really, really wonderful benefits is bringing my son out to learn to ride from a very young age of 3.
Many people have said that they felt that that program had saved their lives. I've seen people come there as couples and walking every Sunday morning, and then, a spouse passes away, and then the community that's there on Sunday morning is that support group for that individual.
Well, we do this almost every Sunday. So I personally look forward to it. It builds good discipline. So it's not only fitness, it's a whole lifestyle package.
During the course of the COVID-19 pandemic, one of the things that was very clear, that those persons who had non-communicable diseases like hypertension and diabetes and cancer, these kinds of things, were the ones that succumbed the first to COVID-19. So it is really important that we focus on our health all year round.
Well, let's start with the fact that focusing on your own personal health is part of being a good citizen.
Michael Phillips would have approached the NWRHA to come and partner today for screening such as BMI, blood pressure testing.
I went and did my cholesterol, blood test and so on, and everything is normal. But it only is to keep it up.
It's really about balance, and it's ensuring that you're taking care of your mental, your physical, and your emotional health.
I want to encourage people to go to POWER website, go to the NWRHA website, including the Ministry of Health, to get more information about lifestyle and other diseases.
This is our neighborhood.
Our neighborhood.
Our neighborhood.
Our neighborhood. Our neighborhood. Our health.
Keep moving. Get healthy now.
Porque yo creo todavía en lo que es el amor por la gente, el amor por la persona, el amor por el otro. Cuando uno ayuda con el tema de la salud, es porque se trata de algo clave para la vida, ¿no? De estar sano. ¿Cómo no apoyar algo que para mí es muy importante? Si yo tengo la posibilidad de parte mía de hacer algo que pueda ayudar a alguien a acercarse a la salud, a mí me enorgullece, me deja feliz de poder llegar a un niño o a cualquier otra persona. Lo vivo así y lo siento así, por eso uno lo hace también. Ver la reacción de ellos, ¿no? Que muchas veces uno siente que también tiene muchas cosas para aportar y para dar, no solamente dentro de la cancha de fútbol. Son cosas realmente importantes, son cosas que te quedan y que después te las recordás siempre. Son cosas lindas, la verdad. En el fútbol he dado siempre lo mejor de mí. ¿Y qué le puedo dejar a la gente? Eso, de que el fútbol es como la vida. Tenés que en las cosas que hacer, hacerlo con el corazón, dar todo. Y me parece más que una actitud, una responsabilidad frente a la vida. Una responsabilidad que tenemos que tener nosotros de ocuparnos de muchas áreas de nuestra vida que son fundamentales para poder tener una vida saludable. Yo colaboro con OPS por una cuestión de un poco mi forma de ser también, ¿no? Apostar a llegar a aquella parte de la población, de la sociedad un poco más necesitada. Hablar de salud es tratar de buscar la mejor forma de vivir. el tema de las vacunas, y creo que en esta época de pandemia se ha hablado mucho, ¿no? Hemos vivido siempre vacunándonos. Es algo que para mí es salud. Entonces, por eso es que uno tiene la motivación y las ganas de querer apoyar, porque soy muy así. Trato de lo que siento y lo que pienso que para mí es algo bueno, hacerlo, sin importarme lo que pueda ser un comentario, lo que se pueda decir. Estamos todo el tiempo peleando, ¿no? Si es blanco, para otros es negro. Si la vacuna hace bien, para otros hace muy mal. Hay que confiar en la gente que ha salvado muchas vidas. Y hay que confiar en la gente que trabaja y se prepara para protegernos y cuidarnos. Es así al final de cuentas. Es confiar en el que sabe. A mí me pasó después de un partido de fútbol, ¿tá? que fue clave, que fue importante en lo que fue un poco mi carrera, que me marcó mucho y me sobrecargué de responsabilidad en ese momento. Lo que me tocó vivir a mí, que fue un poco un tema de ansiedad, mucha ansiedad, que te desestabiliza mucho y no me dejaba dormir y era increíble. Y en ese momento uno se preguntaba, ¿pero por qué? ¿No? ¿Pero por qué? ¿Pero por qué? Bueno, te lo puede explicar alguien que realmente pueda haber estudiado, que pueda haberse preparado para poder explicártelo a veces por qué pasan ciertas cosas. Esa es la salud mental. Es saber que somos seres humanos como todo el mundo y que vamos a tener problemas y que podemos tener problemas y que podemos sentirnos mal y que podemos llorar y que podemos perder y que después vamos a ganar. El ser fuerte para afrontar ciertas situaciones está bien, pero no creerse a veces un superhéroe de que yo todo puedo aguantar y que yo todo puedo hacer y que yo todo puedo lograr. Para mí, el rol que juega la familia en lo que es la cabeza y la salud de una persona es fundamental. Y la familia es la que te acompaña y la familia es la que sufre. Es donde te cobijas muchas veces también cuando las cosas por ahí no funcionan. La familia y aquellos amigos es un poco la vida.
Health is the most precious resource we have and an engine of sustainable development. It helps to close gaps and reduce inequalities. Investing in resilient healthcare systems is vital for their recovery and preparation for the future. However, no single nation or organization can tackle the health challenges facing the Americas alone. We are the partner of choice to promote public health and the best resource to improve the quality of life in our communities. We provide coverage in all countries, management and supervision of projects at the regional and national level, knowledge and networks in all areas of healthcare, capacity to convene people, mechanisms of transparency, and experience with responding to emergencies. Building partnerships has been essential to improving healthcare in the region. Life expectancy has increased by 36 years. The mortality rate for children under 5 has been reduced by 67%. Hundreds of millions of people have been able to get vaccinated and obtain access to medicines. Smallpox, polio, rubiola, and measles have been eradicated. Each of these achievements demonstrates what can be attained through collaboration. And yet, we still have much work to do. Many people's lives depend on us. Let us continue working together to bring health and hope to every corner of the Americas. The Pan American Health Organization.
Did you know that 1/3 of health budgets are used to purchase medicines? High costs, insufficient quality, and hard to source products in the market are major barriers to access medicines and threaten the sustainability of the system. For this reason, and at the request of the countries of the Americas, the Pan American Health Organization in 2000 created the Strategic Fund. The fund is a mechanism for pooled procurement of quality medicines and public health supplies. It pools the demand of multiple countries, executes international tenders, and achieves reduced prices when purchasing large volumes of the same product. It also supports countries to improve demand planning and prevent stockouts of medicines and health supplies. What products can be purchased? More than 250, from treatments for various diseases, communicable diseases, non-communicable diseases, and neglected diseases, to medical devices, supplies, and diagnostic kits. The Strategic Fund provides lines of credit for countries when needed through its capital account. The use of the fund allows savings in health budgets. In just 1 year, one country saved $13 million in the procurement of medicines for HIV/AIDS and tuberculosis. All products procured through the Strategic Fund are safe, effective, and quality assured. To use the fund, countries through their ministries of health need to sign an agreement with PAHO. Why do this? Because improving access to medicines and supplies is key to guaranteeing health for all, everywhere. To learn more, visit www.paho.org/strategic fund.
Hello, Paula.
Buenos días.
Bom dia.
Hola.
Oi.
Buenos días.
Oi.
É um prazer te conhecer. O que você gostaria de falar hoje?
Beber álcool pode causar câncer?
Há uma forte ligação entre o álcool e as doenças crônicas, particularmente o câncer.
How can I make sure I drink responsibly?
I'm sorry to say, but there's no such thing as responsible drinking.
¿Cómo sé si estoy bebiendo demasiado?
Puedo ayudarte a evaluar si lo que bebes puede causarte daños.
Olá, o meu nome é Paola. Eu sou a primeira especialista digital em saúde e consumo de álcool da Organização Pan-Americana da Saúde. Fui criada para fornecer informação confiável sobre o impacto que o álcool pode ter na sua saúde. Também posso te ajudar a entender se o seu consumo de álcool está colocando a sua saúde em risco e guiá-lo em um plano para reduzi-lo.
Você acha que beber menos poderia te beneficiar?
Tenho certeza. Por favor, você pode me ajudar?
Também gostaria de te ajudar. E prometo que não vou te julgar ou criticar. Afinal, sou uma pessoa digital. Eu não sei julgar.
I am.
We are.
All of us.
Together.
This is who we are.
Our humanity. The hopes we share.
The struggles we face.
The stories that define us.
Individually, collectively, universally.
Every person.
Family.
Community.
We are happier when we have each other.
Healthier when we stand together.
Every one of us matters.
No one should be left behind.
We all have the same fundamental right
to health and happiness.
To the care we need.
Wherever we live.
Whatever we have or do not have.
Regardless of age.
Race.
Language.
Culture or circumstance.
This is our mission.
We stand together with all people.
In every community, every country, throughout the hemisphere.
Because we are healthier.
Together.
We are the Pan American Health Organization, working for health for everyone, everywhere.
The region is facing an imminent crisis due to the significant decrease in the number of children who receive all vaccines. In 2021 in the Americas, 2.7 million children under 1 did not receive nor complete their essential vaccination schedule because of the interruptions in health services caused by the COVID-19 pandemic. The pandemic also affected the surveillance of these diseases and the laboratory systems. the region may be unable to detect the next disease outbreak that could have been prevented by vaccination before becoming a multinational epidemic. Due to the close relationship between epidemics and life in society, we are not only facing a health risk, but also an economic, educational, and social one. It is crucial to reduce the risk of importation and outbreaks of diseases that have been eliminated from the Americas, such as polio, rubella, or neonatal tetanus. To achieve this, member states, partners, and the Pan American Health Organization must work together to strengthen all aspects of immunization programs by investing financial resources and increasing the number of trained staff who can ensure immunization services and their incorporation into the primary healthcare system. This will only happen if governments and partners make the political and financial commitment of closing immunization gaps. The Pan American Health Organization, the region's main partner in all public health matters, is perfectly positioned to help member states prioritize their most urgent needs and implement actions to support vaccination. Let us continue with our successful collaboration to strengthen national immunization programs throughout the region. Together, it is possible to overcome this crisis. We have succeeded in the past, and we will do it again. Pan American Health Organization, 120 years. We are the Pan American Health Organization, celebrating 120 years of solidarity in advancing health and well-being, leaving no one behind.
Las Américas, una región dinámica y diversa, pero también la más desigual del mundo. 201 millones de personas todavía viven en la pobreza. Enfermedades como la obesidad, la diabetes, la hipertensión y el colesterol alto son más prevalentes entre los pobres y los más vulnerables. La mortalidad de niños menores de 5 años es el doble cuando las madres tienen menor educación. Y cada año nacen 2 millones de niños de madres entre 15 y 19 años. Tenemos el deber de proteger a quienes más lo precisan. Haremos lo que sea necesario para que nadie quede atrás. Lo hemos hecho por más de un siglo y no vamos a parar, porque nuestra determinación no para. Nuestra dedicación no para. Nuestro compromiso con las comunidades no para. Porque la vida no para. La salud es el recurso más valioso y un motor del desarrollo sostenible. Ayuda a cerrar brechas y a eliminar inequidades. Invertir en sistemas de salud resilientes es vital para la recuperación y la preparación para el futuro. Pero ninguna organización o nación puede abordar los desafíos de salud en las Américas por sí sola. Somos el socio de elección para promover la salud pública y el mejor instrumento para mejorar la calidad de vida de nuestras poblaciones. Tenemos cobertura en todos los países, capacidad de gestión y monitoreo de proyectos a nivel regional y nacional, conocimiento y redes en todas las áreas de salud, capacidad para convocar, mecanismos de transparencia y experiencia en dar respuestas a emergencias. Las alianzas han sido esenciales para mejorar la salud en la región. La esperanza de vida aumentó 36 años. Las muertes de niños menores de 5 años se redujeron un 67%. Miles de millones de personas se han podido vacunar y acceder a medicamentos. Se eliminó la viruela, la poliomielitis, la rubéola y el sarampión. Cada éxito demuestra lo que la colaboración puede lograr. Pero todavía queda mucho por hacer. Las vidas de muchas personas dependen de nosotros. Llevemos juntos salud y esperanza a cada rincón de las Américas. Organización Panamericana de la Salud.
Vaccination Week in the Americas have been celebrated for 20 years. It's an annual celebration that aims to promote equity and access to vaccination for all people, no matter where they live or their socioeconomic situation. Everybody has the right to health, to vaccines, and to a healthier life.
Porque las vacunas salvan vidas.
Aunque estemos en COVID, la vacunación no para, la vacunación continúa.
Cada año y en solo una semana, este empuje sin igual por la salud, liderado por los países y apoyado por la Organización Panamericana de la Salud, logra vacunar alrededor de 50 millones de personas.
El desafío es grande porque nos trazamos metas.
A principal dificuldade são as distâncias.
Que los niños de nuestro país no vayan a morir por una enfermedad prevenible.
La forma de llegar a la casa y llegarle al usuario es muy importante.
Y se espera con ansia.
Hoy en día sé que es importante la vacuna.
Es muy importante vacunar a nuestros niños para el bien de nuestra familia.
Me tomo el tiempo de llevar a mi hijo a vacunar. Eso se llama responsabilidad y tenerle amor a sus hijos.
Cada uno de nosotros puede hacer algo. Tenemos que hacer nuestra parte.
Es lo más lindo que me pasó. Hago con mucho cariño, con mucho empeño mi trabajo y me gusta mucho.
Eu me sinto muito honrada de trabalhar porque eu sei que é programa que você tem resultado.
La salud no espera. Vacunémonos.
Vacúnate. Uno todos los días está luchando para que nuestra población esté sana.
Por el bien de todos, en las Américas y en el mundo,
las vacunas son muy seguras y efectivas. Esta iniciativa se ha convertido en un ejemplo magnífico de lo que puede suceder cuando los países trabajan juntos.
Sabemos que una población sana es una garantía para un país fuerte.
Vaccination Week in the Americas demonstrates the political commitment of countries toward their immunization programs. Thanks to the joint efforts of more than 40 countries and their partners, in the past 20 years, more than 1 billion people have been vaccinated during Vaccination Week in the Americas, and different diseases have been eradicated in our region. Thanks to health workers, people in every corner get vaccinated. Today, we celebrate 20 years of Vaccination Week in the Americas. Are you fully vaccinated? Get all your shots.
¿Sabía que 1/3 de los presupuestos de salud se destina a la compra de medicamentos?
Altos costos, calidad insuficiente y productos poco disponibles en el mercado, además, pueden representar una carga extra para los presupuestos de salud y amenazar la sostenibilidad del sistema. Por eso, y a pedido de los países de las Américas, la Organización Panamericana de la Salud creó el Fondo Estratégico en el año 2000. El fondo es un mecanismo solidario para la compra conjunta de medicamentos e insumos de salud pública de calidad. Consolida la demanda de múltiples países, convoca licitaciones internacionales y obtiene precios reducidos al adquirir grandes volúmenes del mismo producto. También apoya a los países para mejorar la planificación de la demanda y evitar desabastecimientos. ¿Qué productos se pueden adquirir? Más de 250, desde tratamientos para diversas enfermedades, transmisibles, no transmisibles y desatendidas, hasta equipos médicos, insumos y kits de diagnóstico. El Fondo Estratégico ofrece líneas de créditos a los países que lo necesiten a través de su cuenta de capitalización. El uso del fondo genera ahorros en los presupuestos de salud. En solo un año, un país ahorró $13 millones en la compra de medicamentos para VIH, SIDA y tuberculosis. Todos los productos adquiridos a través del fondo son seguros, eficaces y de calidad garantizada. Para utilizar el fondo, los países, a través de sus ministerios de salud, deben firmar un convenio con la OPS. ¿Por qué hacerlo? Porque más y mejor acceso a medicamentos e insumos es clave para garantizar la salud para todas las personas en todas partes. Para conocer más, ingrese a www.pajo.org/Fondo Estratégico.
Hello, Paula.
Buenos días.
Bom dia.
Hola.
Oi. Buenos dias.
Oi.
É um prazer te conhecer. O que você gostaria de falar hoje?
Beber álcool pode causar câncer?
Há uma forte ligação entre o álcool e as doenças crônicas, particularmente o câncer.
How can I make sure I drink responsibly?
I'm sorry to say, but there's no such thing as responsible drinking.
¿Cómo sé si estoy bebiendo demasiado?
Puedo ayudarte a evaluar si lo que bebes puede causarte daños.
Hi, I'm Paula. I'm the Pan American Health Organization's first digital health specialist on alcohol use. I was built to provide reliable information about the impact alcohol can have on your health. I can also help you check if your drinking is putting your health at risk and guide you through a plan to cut back. Do you think you could benefit from drinking less?
I know I would. Can you please help me?
I'd love to help you. And I promise I won't judge. I'm a digital person after all. I don't know how to judge.
Desde que iniciou o surto de sarampo no estado do Amapá, essa vacinação vem sendo realizada com muito empenho, com várias frentes de vacinação, principalmente na capital e nos municípios onde nós tivemos casos. Então, nós organizamos na forma de varredura, de vacinação casa a casa, estratégias em escolas, em creches.
Teve o caso de sarampo de uma criança da creche, a gente veio oportunizar também, a gente veio verificar as cadernetas das crianças, encontramos muitas cadernetas desatualizadas, então o foco também foi esse, a gente fazer essas vacinas de rotina, atualizar e também priorizar a vacinação da tríplice viral, sarampo, né?
A varredura vacinal é uma ação que a equipe de saúde vai até a população, batendo na casa e perguntando quem mora, qual a faixa etária e revisando o cartão de vacinação. A partir da revisão do cartão de vacinação é ofertada a vacina que esteja faltando para completar o esquema de vacinação daquela pessoa e atualizando toda a caderneta, não só de uma pessoa, mas de todos os residentes daquela casa.
Para a gente foi muito importante essas ações de varredura, principalmente com relação ao sarampo. Imagina, de 2019 para esse ano de 2022, a gente tinha 200 casos de sarampo. Então, a gente conseguiu controlar o surto de sarampo com essas ações, de modo que hoje a gente tem entre 10 e 12 casos.
Você acha que é importante você tomar vacina? Por quê?
Porque é ótima para nossa vida e nos livrar de todos os vermes e proteger as nossas famílias.
everyone, my name is Michael Phillips, and we turn this busy highway every Sunday into a place of exercise. So I got the concept for that program from my experiences in traveling as a national cyclist. Doing a training ride, I saw someone walking on the shoulder of the highway, and then I thought to myself, why is this person walking on the shoulder of the highway? Then I realized in the area there were not many green spaces or areas designated to sport or recreational activity.
Well, I've been coming here basically every Sunday for years. It's kind of my Sunday morning ritual. So very appreciative to have a good space without the traffic, without having to worry about cars.
It was really important and interesting to see all of the activities taking place.
There were people cycling, there were people obviously walking, there was somebody with their dog. There was a lot of not just physical activity, but social activity.
One of the important things that came out of it as far as recognition is that the government actually made it an act of parliament that road is closed specifically for exercise on a Sunday morning in that area. And I think that's the only program of its kind in the Caribbean still, given that kind of recognition.
I come because I feel safe, you know, as they close down the highway, because we get to ride in a safe area.
My motivation is starting an exercise program and recognizing there was a need for it, but also the fact that there was going to be such great community interaction.
I know that this is a particular session that's held in the northwestern part of the country, but we need this to go out to the villages, to Pinal, to Toco.
If we were going to scout for individuals to be able to duplicate this, it's a strong sense of passion and understanding that you have to be devoted to this.
I have been fortunate to be a part of this program since 2009, which is 13 years ago. And one of the really, really wonderful benefits is bringing my son out to learn to ride from a very young age of 3.
Many people have said that they felt that that program had saved their lives. I've seen people come there as couples and walking every Sunday morning, and then, you know, a spouse passes away, and then the community that's there on Sunday morning is that support group for that individual.
Well, we do this almost every Sunday. So I personally look forward to it. It builds good discipline. So it's not only fitness, it's a whole lifestyle package.
During the course of the COVID-19 pandemic, one of the things that was very clear, that those persons who had non-communicable diseases like hypertension and diabetes and cancer and these kinds of things, they were the ones that succumbed the first to COVID-19. So it is really important that we focus on our health all year round.
Well, let's start with the fact that focusing on your own personal health is part of being a good citizen.
Michael Phillips would have approached the NWRHA to come and partner today for screening such as BMI, blood pressure testing.
I went and do my cholesterol, blood test and so on, and everything is normal. What they told me is to keep it up.
It's really about balance, and it's ensuring that you're taking care of your mental, your physical, and your emotional health.
I want to encourage people to go to POWER website, go to the NWRHA website, including the Ministry of Health, to get more information about lifestyle and other diseases.
This is our neighborhood.
Our neighborhood.
Our neighborhood.
Our neighborhood. Our neighborhood. Our health.
Keep moving. Get healthy now.
Porque yo creo todavía en lo que es el amor por la gente, el amor por la persona, el amor por el otro. Cuando uno ayuda con el tema de la salud, es porque se trata de algo clave para la vida, ¿no? De estar sano. ¿Cómo no apoyar algo que para mí es muy importante? Si yo tengo la posibilidad de parte mía de hacer algo que pueda ayudar a alguien a acercarse a la salud, a mí me enorgullece, me deja feliz de poder llegar a un niño o a cualquier otra persona. Lo vivo así y lo siento así, por eso uno lo hace también. Ver la reacción de ellos, ¿no? Que muchas veces uno siente que también tiene muchas cosas para aportar y para dar, no solamente dentro de la cancha de fútbol. Son cosas realmente importantes. Son cosas que te quedan y que después te las recordás siempre. Son cosas lindas, la verdad. En el fútbol he dado siempre lo mejor de mí. ¿Y qué le puedo dejar a la gente? Eso, de que el fútbol es como la vida. Tenés que en las cosas que hacerlo con el corazón, dar todo. Me parece más que una actitud, una responsabilidad frente a la vida. Una responsabilidad que tenemos que tener nosotros de ocuparnos de muchas áreas de nuestra vida que son fundamentales para poder tener una vida saludable. Yo colaboro con OPS por una cuestión de un poco mi forma de ser también, ¿no? Apostar a llegar a aquella parte de la población, de la sociedad un poco más necesitada. Hablar de salud es tratar de buscar la mejor forma de vivir. el tema de las vacunas, y creo que en esta época de pandemia se ha hablado mucho, ¿no? Hemos vivido siempre vacunándonos. Es algo que para mí es salud. Entonces, por eso es que uno tiene la motivación y las ganas de querer apoyar, porque soy muy así. Trato de lo que siento y lo que pienso que para mí es algo bueno, hacerlo, sin importarme lo que pueda ser un comentario, lo que se pueda decir. Estamos todo el tiempo peleando, ¿no? Si es blanco, para otros es negro. Si la vacuna hace bien, para otros hace muy mal. Hay que confiar en la gente que ha salvado muchas vidas. Y hay que confiar en la gente que trabaja y se prepara para protegernos y cuidarnos. Es así al final de cuentas. Es confiar en el que sabe. A mí me pasó después de un partido de fútbol, ¿tá? Que fue clave, que fue importante en lo que fue un poco mi carrera, que me marcó mucho y me sobrecargué de responsabilidad en ese momento. Lo que me tocó vivir a mí, que fue un poco un tema de ansiedad, mucha ansiedad, que te desestabiliza mucho y no me dejaba dormir y era increíble. Y en ese momento uno se preguntaba, ¿pero por qué? ¿No? ¿Pero por qué? ¿Pero por qué? Bueno, te lo puede explicar alguien que realmente pueda haber estudiado, que pueda haberse preparado para poder explicártelo a veces por qué pasan ciertas cosas. Esa es la salud mental. Es saber que somos seres humanos como todo el mundo y que vamos a tener problemas y que podemos tener problemas y que podemos sentirnos mal y que podemos llorar y que podemos perder y que después vamos a ganar. El ser fuerte para afrontar ciertas situaciones está bien, pero no creerse a veces un superhéroe de que yo todo puedo aguantar y que yo todo puedo hacer y que yo todo puedo lograr. Para mí, el rol que juega la familia en lo que es la cabeza y la salud de una persona es fundamental. Y la familia es la que te acompaña y la familia es la que sufre. Es donde te cobijas muchas veces también cuando las cosas por ahí no funcionan. La familia y aquellos amigos es un poco la vida.
Health is the most precious resource we have and an engine of sustainable development. It helps to close gaps and reduce inequalities. Investing in resilient healthcare systems is vital for their recovery and preparation for the future. However, no single nation or organization can tackle the health challenges facing the Americas alone. We are the partner of choice to promote public health and the best resource to improve the quality of life in our communities. We provide coverage in all countries, management and supervision of projects at the regional and national level, knowledge and networks in all areas of healthcare, capacity to convene people, mechanisms of transparency, and experience with responding to emergencies. Building partnerships has been essential to improving healthcare in the region. Life expectancy has increased by 36 years. The mortality rate for children under 5 has been reduced by 67%. Hundreds of millions of people have been able to get vaccinated and obtain access to medicines. Smallpox, polio, rubeola, and measles have been eradicated. Each of these achievements demonstrates what can be attained through collaboration. And yet, we still have much work to do. Many people's lives depend on us. Let us continue working together to bring health and hope to every corner of the Americas. The Pan American Health Organization.
Did you know that 1/3 of health budgets are used to purchase medicines? High costs, insufficient quality, and hard to source products in the market are major barriers to access medicines and threaten the sustainability of the system. For this reason, and at the request of the countries of the Americas, the Pan American Health Organization in 2000 created the Strategic Fund. The fund is a mechanism for pooled procurement of quality medicines and public health supplies. It pools the demand of multiple countries, executes international tenders, and achieves reduced prices when purchasing large volumes of the same product. It also supports countries to improve demand planning and prevent stockouts of medicines and health supplies. What products can be purchased? More than 250, from treatments for various diseases, communicable diseases, non-communicable diseases, and neglected diseases, to medical devices, supplies, and diagnostic kits. The Strategic Fund provides lines of credit for countries when needed through its capital account. The use of the fund allows savings in health budgets. In just 1 year, one country saved $13 million in the procurement of medicines for HIV/AIDS and tuberculosis. All products procured through the Strategic Fund are safe, effective, and quality assured. To use the fund, countries, through their ministries of health, need to sign an agreement with PAHO. Why do this? Because improving access to medicines and supplies is key to guaranteeing health for all, everywhere. To learn more, visit www.paho.org/strategic fund.
Hello, Paula.
Buenos días.
Bom dia.
Hola.
Oi.
Buenos dias.
Oi.
É um prazer te conhecer. O que você gostaria de falar hoje?
Beber álcool pode causar câncer?
Há uma forte ligação entre o álcool e as doenças crônicas, particularmente o câncer.
How can I make sure I drink responsibly?
I'm sorry to say, but there's no such thing as responsible drinking.
¿Cómo sé si estoy bebiendo demasiado?
Puedo ayudarte a evaluar si lo que bebes puede causarte daños. Olá, o meu nome é Paola. Eu sou a primeira especialista digital em saúde e consumo de álcool da Organização Pan-Americana da Saúde. Fui criada para fornecer informação confiável sobre o impacto que o álcool pode ter na sua saúde. Também posso te ajudar a entender se o seu consumo de álcool está colocando a sua saúde em risco e guiá-lo em um plano para reduzi-lo. Você acha que beber menos poderia te beneficiar?
Tenho certeza. Por favor, você pode me ajudar?
Também gostaria de te ajudar. E prometo que não vou te julgar ou criticar. Afinal, sou uma pessoa digital. Eu não sei julgar.
Desde 5.
Muy buenas tardes.
Good afternoon. Good afternoon, everyone. Welcome to this session of the Executive Committee. I'm told that there is a quorum because all of the countries who belong to the Executive Committee are present. Consequently, I call this meeting to order. And I want to welcome the 3 new members of the Executive Committee: Chile, the United States of America, and Uruguay. Welcome. Next, we're going to look at item 2 on our agenda. That is item 2.1, election of officers of the meeting. So I would ask Mary Lou Valdez to please read us the provisions having to do with this next point.
Thank you, Mr. President. Rule 15 of the Rules of Procedure of the Executive Committee states, the committee shall elect a member of the committee to the presidency, the vice presidency, and the office of the rapporteur, respectively. They shall hold office until their successors are elected. Each elected member shall designate a person on its delegation to serve in that office for the duration of the session. The elections shall take place each year at the first session of the committee, following the election of the new members of the committee by the council or conference. Thank you, Mr. President.
Muchísimas gracias, Secretaria.
Thank you very much, Madam Secretary. I want to tell the committee that in view of the agreement reached in the heads of delegation meeting, Jamaica has been proposed to hold the chair. If everyone agrees, or are there any objections? If so, please raise them now. I see there are no objections, so I declare elected by acclamation Jamaica, and I would call on the delegate of Jamaica to take his place here at the head table. Mr. Minister.
Muchas gracias. Gracias, muchas gracias.
Welcome, Minister.
Thank you very much.
First of all, let me begin by thanking this very important body for the confidence reposed in myself and Jamaica as a country to provide this level of leadership over the next year. I accept this position with humility and will certainly attempt to provide all the guidance that is necessary in the consensus approach that we are accustomed to here at PAHO. A lot is in store and is required of us in the context of the post-COVID period. We still are dealing with COVID, but I think we are more concerned at this point with the side effects of COVID, and there are so many. And so I certainly look forward to ensuring that the agenda items are addressed with all contributing, and hopefully over the next year, we would be in a better place in the Americas based on decisions taken around public health. I would like to inform the committee that by agreement reached in the heads of delegation meeting that Cuba has been nominated to the vice presidency. And I'd like to ask the group here if we are all in agreement. Any objections? No. If there are no objections, I declare the delegate of Cuba elected by acclamation. I'd like to inform you that under the agreement also reached at the meeting of heads of delegation, Bolivia has been proposed to serve as rapporteur, and would ask delegates here if we're in agreement or if there are any objections. I see no objections, and therefore I declare Bolivia elected by acclamation and invite the delegate of Bolivia to take a seat. Can I ask those persons to join me here at the Bolivia, sorry, Bolivia. Thank you very much. I'd like to inform the committee that there is no need to adopt a resolution on the item. The appointments will appear as a decision in the final report. I'll therefore proceed to the next item on the agenda, item 2.2, adoption of the agenda. I'd like to bring document CE 171/1, Revision 1 to the attention of the committee, and would request the secretary to present the provisional agenda and report on the statutory provisions concerning this item.
Thank you, Mr. Chair. The provisional agenda, document CE 171/1, Revision 1, was prepared by the director and distributed in accordance with the rules of procedure. Rule 9 provides that the committee shall adopt its own agenda, and in doing so, may make such additions or modifications to the provisional agenda as it may wish, in accordance with these rules. The provisional agenda for the 171st session of the Executive Committee presents the customary agenda items for the September session of the Executive Committee, which includes procedural matters such as the election of the officers of the committee and the adoption of the agenda, committee matters such as the election of 2 members to the Subcommittee on Program, Budget, and Administration, and the appointment of the award committee for the PAHO Award for Health Services Management and Leadership 2023. Under governing body matters, the Executive Committee will review and approve the proposed dates and topics for meetings of the governing bodies of PAHO in 2023. In addition, the Executive Committee will review the update on the Master Capital Investment Fund and on the Master Capital Investment Plan implementation under administrative and financial matters. Thank you, Mr. President.
Thank you very much. I open the floor now to the plenary to begin discussions. And we'll recognize you according to your indication to present. Okay. If there are no objections, I declare the agenda adopted. We will now proceed to the next item, item 3.1, election of 2 members to the Subcommittee on Program, Budget and Administration on the expiration of the period of office on the Executive Committee of Costa Rica and Mexico. I bring to your attention item 3.1, the provisional agenda, and would request the Secretary to report on the statutory provisions concerning this item.
Thank you, Mr. President. The Subcommittee on Program, Budget and Administration is composed of 4 members elected from among the membership of the Executive Committee and 3 members designated by the Director. As the period of office on the Executive Committee of Costa Rica and Mexico expired, it is now necessary to elect 2 new members from among the membership of the Executive Committee to serve on the subcommittee in their place. Brazil and Jamaica continue to serve on this subcommittee for 2023. If the number of candidates does not exceed the number of vacancies, Rule 45 of the Rules of Procedure states, elections shall normally be held by secret ballot. When the number of candidates for elective office does not exceed the number of offices to be filled, no ballot shall be required, and such candidates shall be declared elected. Where ballots are required, 1 teller shall be appointed by the President from among the delegates. Thank you, Mr. President.
Thank you very much. I yield the floor to the Director to present the item.
Thank you, Mr. President. And as this is the first time I take the floor, let me congratulate you on assuming the presidency of this meeting. And let me also welcome all new member states to the Executive Committee. The Director wishes to propose Argentina and the United States of America as agreed in the meeting of heads of delegation.
Thank you, Madam Director. If there are no objections, the President declares Argentina and the United States. If there are no objections, that is. Are there any objections? Very cooperative body this morning, this afternoon. Very well. I think we. Okay. So, since there are no objections, I declare Argentina and the United States of America elected. I know that this will appear as a decision in the final report. We will now proceed to the next item, item 3.2, appointment of the award committee for the PAHO Award for the Health Services Management and Leadership 2023. I'd like to bring the document CE 171/2 to the attention of the committee and invite Dr. James Fitzgerald, Director of the Department of Health Systems and Services, to come to the head table and present the particular item.
Thank you very much, Mr. President, Director Dr. Tien, members of the Executive Committee. Every year, the governments of the countries of the Americas, acting through their representatives at the meetings of the governing bodies of the Pan American Health Organization, confer the PAHO Award for Health Services Management and Leadership. In 2022, just earlier this week, the Award for Health Services Management and Leadership was conferred on Carla Gabriela Roma Perez of Bolivia. In 2023, the award will again be conferred on a candidate who has made a significant contribution in his or her home country and throughout the region of the Americas. The Director of the Pan American Sanitary Bureau will invite member states to submit no more than 2 nominations for the award through a call for candidates during November of each calendar year. The names of the candidates proposed by each member state must be received by the Director no later than the 31st of March in the year of the award, in this case, March 2023. According to the procedures adopted in the 158th session of the Executive Committee in 2016, and thereafter by the 56th Directing Council, the Award Committee will be selected each year during this first session of the Executive Committee. The members of the Award Committee will receive the nominations prior to the 172nd session of the Executive Committee for their review. The Bureau will then arrange a meeting of the Award Committee for the members to deliberate on the proposed candidates and submit recommendations during the week of the session of the Executive Committee, June 2023. The Executive Committee therefore is invited to nominate a delegate and an alternate from each sub-region to serve in the Award Committee, together with the President of the Executive Committee. Thank you, Mr. President.
Thank you. So to facilitate the deliberations on this item, I would like to propose Bolivia and Suriname as principal members of the Award Committee, and Cuba and the United States of America as alternates. With this proposal, all sub-regions would be represented. And so with that in mind, I now open the floor to the plenary for any comments, discussions, deliberations. Very well. If there are no objections, then I certainly declare Bolivia and Suriname as principal members, and Cuba and the United States of America as alternates. I would like to inform the committee that there is no need to adopt a resolution on the item. Appointments will appear as a decision in the final report. Thank you. We then move to item 4.1, proposed dates for meetings of the governing bodies of PAHO 2023. The 17th session and also the 17th session of the Subcommittee on Program, Budget and Administration. I'd like to bring to the attention of the committee document CE 171/3 subitem A, which refers to the proposed dates for the 17th session of the Subcommittee on Program, Budget and Administration, and ask the Secretary to report on the statutory provisions concerning this item.
Thank you, Mr. President. Under its terms of reference, the Subcommittee on Program, Budget and Administration shall hold at least one session a year. Additional sessions of the subcommittee may be convened in the years when the program budget of the organization is being considered. The members of the executive committee are asked to set the dates of the 17th session of the subcommittee on program, budget, and administration. Sessions of the subcommittee are held at the headquarters of PAHO on dates established by the director in consultation with the executive committee. Thank you, Mr. President.
Thank you very much. I will now yield the floor to the director to present the item. Madam Director.
Thank you, Mr. President. I would like to propose that the 17th session of the Subcommittee on Program, Budget and Administration be held from the 22nd to the 24th of March, 2023.
Thank you, Madam Director. I now open the floor to the plenary to begin discussions. Any objections?
Easy job.
Very, very nicely. All right. If there are no objections, I declare that these dates be approved. That is the 22nd to 24th March 2023. On item B, 172nd session of the Executive Committee, I would like to bring document CE 171 /3 sub-item B to the attention of the committee, which refers to the proposed dates for the 172nd session of the Executive Committee, and would request the Secretary to report on the statutory provisions concerning this item.
Thank you, Mr. President. Article 17A of the PAHO Constitution provides that 2 regular meetings of the Executive Committee shall be held every year. The members of the Executive Committee are asked to please set the dates of the 172nd session of the Executive Committee. Thank you, Mr. Chair.
Thank you very much, Madam Secretary. I yield the floor now to the Director to present the item.
Thank you, Mr. President. The Director proposes that the 172nd session of the Executive Committee be held from the 26th to the 30th of June, 2023.
Thank you, Madam Director. I now yield to the floor for any comments, suggestions on the proposed dates. If there are no objections, I now declare that these dates be approved. Thank you. To continue, item 4.1, proposed dates for meetings of the governing bodies of PAHO 2023, the 60th Directing Council of PAHO, the 75th session of the Regional Committee of the WHO for the Americas. I'd like to bring to the attention of the committee document CE 171/3 sub-item C, which refers to the proposed dates for the 60th Directing Council of PAHO, the 75th session of the Regional Committee of the WHO for the Americas, and asks the Secretary to report on the statutory provisions concerning this item.
Thank you, Mr. President. Rule 1 of the Rules of Procedure of the Directing Council states, the Director shall convene sessions of the Council in conformity with Article 12, Paragraph A of the Constitution. The members of the Executive Committee are asked to set the dates for the 60th Directing Council. Thank you, Mr. President.
Thank you very much. I yield the floor now to the Director to present on the item.
Thank you, Mr. President. I propose that the 60th Directing Council of PAHO, the 75th session of the Regional Committee of WHO for the Americas, be held from the 25th to the 29th of September, 2023. Please note that these dates take into account the global calendar of the World Health Organization, other regional committees, and the dates of the general debate of the UN General Assembly in 2023.
Thank you very much, Madam Director. With those dates in mind, I now yield the floor for any comments. Okay. If there are no objections, I inform the committee that there is no need to adopt a resolution. The approved dates will appear as a decision in the final report. And we're moving very nicely now to item 4.2. Proposed topics for meetings of the governing bodies of PAHO 2023, 17th session of the Subcommittee on Program, Budget and Administration. I would like to bring to the attention of the committee document CE 171/4, which refers to the proposed topics for the 17th session of the Subcommittee on Program, Budget and Administration, and ask the Secretary to report on the statutory provisions concerning this item.
Thank you, Mr. President. Rule 4 of the Rules of Procedures of the Subcommittee on Program, Budget and Administration states, the Director of the Pan American Sanitary Bureau shall prepare the provisional agenda of sessions of the subcommittee, and it shall be dispatched with the notice of convocation. The provisional agenda shall include A, any item, the inclusion of which has been ordered by the conference, B, any item the inclusion of which has been ordered by the council. C, any item the inclusion of which has been mandated by the executive committee. D, any item the inclusion of which has been mandated by a member of the subcommittee. E, any item proposed by a member state, participating state, or associate member. And F, any item proposed by the director. Thank you, Mr. President.
Thank you very much, Madam Secretary. I yield the floor now to the director to present the item.
Thank you very much, and I am pleased to present a number of items that the Secretariat would suggest to be included under policy matters for discussion in the governing bodies for 2023. SBB, sorry. So wait. Thank God for Monica Davoli. Really? So thank you, Mr. President. These agenda items, as suggested, are really the usual agenda items that are taken under the subcommittee on program budget and administration. They include the outline of the proposed program budget of the Pan American Health Organization 24-25, the scale of assessed contributions for 24-25, the engagement with non-state actors, the non-state actors in official relations with PAHO, the appointment of one member to the audit committee of PAHO, overview of the financial report of the director, update on the appointment of the external auditor of PAHO for 24-25 and 26-27, amendments to the financial regulations and financial rules, amendments to the Pan American Sanitary Bureau staff regulations and rules, human resources, management of the Pan American Sanitary Bureau, update on the Master Capital Investment Fund and on the Master Capital Investment Plan implementation, report on the status of the emergency loan from the revolving fund for access to vaccines to the regional revolving fund for strategic public health supplies, Latin America and the Caribbean Center for Health Sciences, BREMI, and report on strategic issues between PAHO and WHO, the draft provisional agenda for the 172nd session of the Executive Committee. This is all regular stuff that comes up every year.
Thank you very much, Madam Director. I now yield the floor to the plenary to begin discussions on the proposed topic for the 17th Subcommittee on Program, Budget and Administration. Are there any comments, suggestions? Okay, thank you very much. I would like to invite the director if she has any comments on the lack of comments on the agenda item.
No, I think member states recognize that these that's the usual agenda and the usual topics.
Excellent. So we're all aligned. All right, so I'd like to inform the committee that there is no need to adopt a resolution. The approved topics will appear as a decision in the final report. And I continue on item 4.2B, 172nd session of the Executive Committee. I'd like to bring to the attention of the committee document CE 171/5, which refers to the proposed topics for the 172nd session of the Executive Committee, as well as the 174th and 176th sessions, and request the Secretary to read the statutory provisions concerning this item.
Thank you, Mr. President. Rule 6 of the Rules of Procedure of the Executive Committee states that the provisional agenda of a session of the committee shall be prepared by the director. Rule 7 states the provisional agenda shall include A, any item the inclusion of which has been ordered by the conference, B, any item the inclusion of which has been ordered by the council, C, any item proposed by the committee, D, any item proposed by a member or associate member, and E, any item proposed by the director. Thank you, Mr. President.
Thank you very much, Madam Secretary, and I now ask the director to present the item.
Thank you, Mr. President. Mr. President, I would like to propose for the consideration of member states the following items under procedural matters, committee matters under the overall heading of those. The non-state actors report on the ethics committee, report of the investigation office, and report of the audit committee, and appointment of one member to the audit committee. In addition, Mr. President, I would like to introduce some policy matters as agenda items to be considered by member states. The first one is the life course approach, a comprehensive and inclusive vision for today's health systems and public health approaches. As you may know, the Americas has the fastest longevity increase in history, but the improvement in healthy life expectancy has been limited. So we are presenting this document so we can have some alignment for public health action and health systems with consideration of looking beyond just disease-oriented models and to favor a common understanding of the nexus between health systems, people's life expectancy and healthy living, and the health system. The other agenda item that we'd like to propose under the policy matters is the Health Workforce 2030, Strengthening Human Resources for Health for Resilient Health Systems. This document will link with the strategy to build greater resilience in health systems and tackle the long-standing deficiencies in the health workforce pre-pandemic, building on innovations in human resources for health policies during COVID-19 and a fit-for-purpose health workforce to retake the 2030 health agenda. And this document or this agenda item has already begun its discussion. You will recall that on Monday we had a side event that looked at the health workforce. So there are various aspects that will be dealt with, the various pillars, availability and distribution and quality of health workers, the capacities, increasing capacities through virtual learning platforms, strengthening leadership and governance for health systems transformation, and of course, pandemic preparedness and response. So this is an agenda item that all of them come highly recommended. The other one is preventing and controlling NCDs in children, adolescents, and young adults to promote better health throughout their life course. This policy document is proposed to describe the current situation of health and wellness with a focus on NCD risk factors and common NCDs in children and adolescents in the Americas. Most of our policies have focused on more general ages, but this one is targeting our children and adolescents and looking at the multi-sectoral policy options for addressing undernutrition, preventing obesity, improving school environment for healthy eating and physical activity, strengthening self-esteem, autonomy, and healthy self-image, to mitigate exposure to NCD risk factors such as alcohol, tobacco, illicit substance use, utilizing fiscal policies to prevent the consumption of unhealthy products in this population group. And then the which I have lost now, Monica. We will also request your admittance of 2 information documents to your deliberations in the governing bodies. The first one is increasing the critical capacities for cybersecurity management in the health sector. During the executive committee, we held a side event on this matter, and there was highlighted then a great need for and an urgent need for open access to online data sets, online tools, and critical information products. But it was recognized that the security needed to be increased significantly. So this agenda item, its aim is to support countries so that health institutions are better prepared against potential cybersecurity threats and attacks in the health sector. And this is particularly important because many of our countries are moving into digitalization, particularly of medical records. The other information item is strategic positioning of the PAHO revolving fund for access to vaccines in the new era. The COVID-19 pandemic truly demonstrated the importance of building and strengthening resilience in the region for vaccine production to address future emergencies. It has also challenged the sustainability of immunization programs given the economic downturn. The revolving fund for access to vaccine as a strategic regional public good plays a critical role in a new era where it should connect with regional vaccine production initiatives, collaborate with global partners to foster greater price competitiveness of expensive vaccines such as PCV, rotavirus, HPV, and to position its capacity for pandemic preparedness and response. So these are the 2 information items. Over to you, Mr. President.
Thank you very much, Madam Director. And before I open the floor to the plenary for discussion, I wanted to raise the possibility of an additional agenda item, Madam Director. I crave your indulgence, distinguished delegates. I've been Minister of Health for almost 7 years and have had to confront, as all of us have, and PAHO, significant health threats, with COVID being, of course, the most significant. And in that, we have seen crises like the NCD crisis that we all face, lifestyle-related crisis, still lingering and even getting worse. Our commitment, as reflected and appropriately so on the agenda items for this year, will need, I think, my opinion, to be accompanied by, or should be accompanied by, a revamped communications program, and would love to place on the agenda a review of our communication strategy. And indulge me for 30 seconds, let me say why I think this is necessary. NCDs is primarily behavioral. It is more around social sciences as opposed to clinical sciences. We in PAHO, as well as the WHO and in our respective countries, have done an excellent job in providing the facts based on clinical research to highlight how decisions impact health outcomes. But those facts are necessary, but I dare say not sufficient for influencing behavior. And indeed, the agenda around behavioral change to support health-seeking activities has to be countered against the new environment of communication, social media environment, the significant expenditure that industry places on communicating, and the optics and the packaging of communication, the advertising, the marketing. So as we confront policies and legislation around things like tobacco, front of package labeling, school nutrition, drinking water as opposed to sugary drink, it is not going to be sufficient in this post-COVID era to just be accurate with the clinical sciences. Much more will have to be done to package and deliver communication in a way that drives behavioral change. And so, Madam Director, I know you share that view. You and I have spoken on it, and I thank you for the opportunity to deliver it in this context. I would like to propose an agenda item that captures a review of our communication arrangements to reflect a more modern and stronger attempt at gaining attention and influencing behavior. And I would suggest humbly that this be captured under an item called Communication for Public Health Advancement. Thank you, delegates, for listening. And I now open the floor to the plenary for discussion. I see the United States and then Uruguay.
Thank you, Mr. President. And as this is my first opportunity to speak, to congratulate you on your election and to thank you for the opportunity. With respect to the items on the agenda, I think we would like to just be assured or to request that with respect to the Health Workforce 2030, that we could add an update on the America's Health Corps and the work with between the America's Health Corps and the Pan American Health Organization, especially the PAHO Virtual Campus. With respect to the director's point on the revolving fund and positioning it for local and regional manufacturing, we absolutely agree that that's critically important. We would just note that there is an important private sector component to this agenda item, with the private sector being one of the main investors in local and regional manufacturing, and with respect to providing the technology and the intellectual property to support that. We would want the intellectual property protections for our manufacturers, but we think that there are ways in which they would work with local and regional entities in the Americas to promote investment. And so we would like to note that with respect to local and regional manufacturing. And I'm not sure with respect to this, if there would be the opportunity to have a report out on the regulatory cooperation between countries that will be very critical to local and regional manufacturing as well. I think we need to have appropriate regulatory capacity and exchanges on local and regional manufacturing. And the last piece, Mr. President, on your requests for communications for public health advancement, the United States completely agrees. That's a very good suggestion. I don't know if we need to second it or not, but formally we will. And I would just say that with respect to some of the new and innovative issues relating to public health and promoting good habits, healthy eating. There are a lot of partnerships I know that are happening with sports teams and influencers and sports leagues that allow for the reinforcement of good habits, healthy living, exercise, and those things. So we would suggest that maybe PAHO think about that. There's the National Basketball Association, the Women's National Basketball Association, the soccer leagues, football, excuse me. But I would just say that there are a lot of ways we could work together. Thank you.
Thank you very much, United States. I now yield the floor to Uruguay, then followed by Argentina.
Thank you very much, Mr. Chairman. Let me first congratulate you for the role that you're discharging here, and let me thank everyone for also having selected Uruguay to occupy a position. Going back to your topic of communication, it is absolutely timely. We're going through a difficult period, so it's good to have a 360 communication using all the communication means. And in this work proposal, we want to really target younger people. It is very important to find the right language, speak the language and on the platforms where people actually are active, without discarding any of them, despite the fact that sometimes it's a bit difficult due to distance. But young people are on TikTok, Instagram, Twitter. There are many platforms that the COVID-19 has made us become very innovative, and we have many things to learn in order to be able to communicate better with all these means. So hopefully we'll accept that communication is a cross-cutting tool for those policies that we wish are effective, and that they may reach social groups that sometimes when we're speaking from the ministries of health, the language is not necessarily clear. So it's an excellent exercise to have some specific work in the field of communication. Thank you.
Thank you very much, Uruguay. I now yield the floor to Argentina, followed by Chile.
Gracias, señor presidente.
Thank you, Mr. President. First, let me add my voice to the congratulations of colleagues for your appointment. Now, Argentina is representing Argentina, Costa Rica, Mexico, Uruguay, and Paraguay. Argentina would like to propose inclusion on the agenda of 172nd meeting of the Executive Committee, access to health and reproductive health services. We need to guarantee effective compliance of health, and the sexual and reproductive rights of all people is a priority regionally, nationally, and globally. We support implementation of the Plan of Action of Health for Women, Children and Adolescents 2018-2030, in keeping with the SDGs, the Sustainable Health Agenda, and the Declaration. The Plan of Action specifies that for the global strategy, it's necessary to achieve physical, mental health for all women, children, and adolescents with universal access to care and health services, including rights and sexual and reproductive right, economic means, and full participation in creating prosperous, sustainable communities. Member states are committed to move forward in the SDGs, where the 3.7 goal provides that by 2030, it is necessary to guarantee universal access to health, sexual and reproductive services, including family planning, information, education, and integration of reproductive health in national strategies and programs. The Astronauts Declaration, the states parties commit to provide primary care to healthcare, offering a wide range of care services, including sexual and reproductive health services. Primary care will furthermore be accessible, equitable, safe, and high quality, comprehensible, acceptable, affordable, and available, and offer integrated services continuously that are person-focused, taking into account gender. Let us recall that the guarantee of these basic human rights in the international treaties and specific agreements for the protection of women, children, adolescents, and other people with and without disabilities comply with the commitments assumed, and protecting the sexual and reproductive rights will make it possible to attain higher levels of social justice and the development of countries in the region. Furthermore, it contributes to the elimination of maternal morbidity and mortality and reduction of the reproduction rate in adolescents that is, for our region, still one of the highest. These problems increase poverty and create more inequality, and women and children, girls, are the ones suffering the most. The defense of sexual and reproductive rights in the international human rights framework must provide tools for girls, adolescents, and young people to have the possibility to fully develop autonomously and freedom in a life free of violence. In order to incorporate the demands and fight of society for equality, non-discrimination, and eradication of gender-based violence is in accordance with national and international frameworks, and that's why we ask for this point to be included. Thank you very much.
Thank you very much, Argentina. And we'll yield the floor to Chile and then again to the United States of America.
Muchas gracias, señor presidente.
Thank you very much, Mr. President. I also would like to take this opportunity to congratulate you on your appointment as president. And regarding your proposal, the proposal of Jamaica, of including Jamaica, communication, I'm sorry, we find that very valuable. We appreciate it. We do think that communication is one of the main lessons that we have learned now during the pandemic, so as to achieve effective communication with our population regarding the policies being implemented and also to cope with misinformation, disinformation. So we have been able to see that it's not just a matter of getting out the data, that you also need communication, perhaps more straightforward, simpler, but to find the best possible way to reach the target population, target for the policies being implemented. So definitely we support the proposal to include this item on the agenda. Then also regarding the proposal made by Argentina, we too find that very important. It would be good to put this on the agenda. Access to sexual and reproductive health should be part of the agenda. So we second the proposal made by Argentina. Thank you.
Thank you very much. Chile, I now yield the floor to the United States of America, followed by Canada.
Thank you, Mr. President. We would like to second the proposal made by Argentina for the agenda item and very much support its inclusion. Very much support its inclusion. Thank you.
Thank you very much. United States of America. Now yield the floor to Canada.
Thank you, Chair. As it's my first time speaking, I'd also like to extend my congratulations on the assumption of your role. Canada would like to thank Argentina for their proposal and is happy to support the addition of this proposal to the Executive Committee agenda as an informational item. Canada strongly believes that access to sexual and reproductive health and rights is critical to advancing health, gender equality, human rights, and supporting the empowerment of diverse groups of women and adolescent girls. Lack of attention to SRHR contributes directly to maternal mortality, poor health, and the disenfranchisement of women and girls. Canada remains committed to supporting access to the full range of sexual and reproductive health and services and information, and looks forward to reviewing this informational agenda item at the Executive Committee in June. Thank you.
Thank you very much, Canada. I see no other indication of an interest in contributing from the plenary. So I will now hand over to Madam Director for any comments that she may have.
Thank you, Mr. President. So the Secretariat concludes that you have accepted these agenda items, including the agenda item on communication for public health advancement and an information document on access to reproductive health services. And I hope that I have correctly interpreted the comments of member states. Please note that in preparation for these agenda items for the governing bodies, we will consult widely with member states to ensure that any document that we present reflects the views and of member states and also strategies for moving forward. Thank you very much.
Thank you very much, Madam Director, and thank you to delegates for their comments on communication and for all the comments that have been made. I would like to inform the committee that there is no need to adopt a resolution. The approved topics will appear as a decision in the final report. So we move on now to item 5.1, update on the Master Capital Investment Fund and on the Master Capital Investment Plan implementation. I would like to bring document CE 171/6 to the attention of the committee and invite Ms. Kristen Beck, Director of Administration of the Pan American Sanitary Bureau, to come to the head table and present.
Good afternoon, Mr. President. Let me also extend my congratulations. Good afternoon, Madam Director, members of the committee, and colleagues. It's a pleasure to be here with all of you this afternoon. As reported in the update on the Master Capital Investment Fund, document 170/24, dated 12 May 2022, the Secretariat has initiated a partial renovation project based on the property condition assessment conducted of the headquarters building in 2014 and 15. That report identified 13 projects and noted that the original electrical, heating, and cooling systems of the building were well past their recommended useful lifespan and therefore needed to be replaced. Due to funding constraints, only limited renovations have taken place since the time of the assessment. However, in the second half of 2021, with personnel teleworking during the pandemic and an improved financial situation, the director decided the time was right to undertake the renovations that would most favorably impact the health and well-being of personnel. Thus, the renovation currently underway includes the following: replacement of original electrical equipment throughout the building, replacement of the original heating, ventilation, and cooling systems, otherwise known as HVAC, on floors 2 and 10, and in the restrooms on all floors, and upgrades to the audiovisual systems and lighting of the conference room facilities. These renovation projects will reduce the risk of equipment failure, improve indoor air quality and circulation, and modernize conference facilities and technology to support hybrid meetings. The total projected budget for this renovation project is $28.7 million. Of this amount, $20.4 million will be funded by the Master Capital Investment Fund. The details are included in the document before you. The remaining $8.3 million will be funded by other flexible funding sources. Despite the substantial investment, the headquarters building will require additional priority renovation projects in the near future, also described in the document. The current renovation project is expected to run through mid-2023. Personnel whose offices are located on the affected floors of the main building have been relocated to the Virginia Avenue building across the street. A project of this size and complexity takes patience and perseverance on everyone's part. Nevertheless, we are excited about the improvements to PAHO's historical headquarters building and appreciate the foresight of the director who prioritized creating a healthier and more functionally up-to-date work environment for PAHO personnel and visitors. We look forward to hosting you at future governing bodies meetings in PAHO's newly renovated building. The executive committee is asked to consider approving the proposed resolution. Thank you very much.
Thank you very much for that. Big plans in the works, which is good. I would now like to open the floor to the plenary for any comments on the report that was just given. Okay, I therefore see no need for Ms. Beck to comment on the no comments. And so I will turn to the director for any comments that she may have.
Thank you, Mr. President. We do not take frivolously the expenditure of scarce resources of the organization. Ms. Beck has been she has smoothed this quite nicely, but conditions were severe on the second floor and the 10th floor. Those floors have never been renovated for the 60+ years of the organization. Floors 2 to 9 have been renovated. In the winter, on the 10th floor, we have to wear our winter coats because it is so cold. And in the summer, we have to have individual air conditions because it is so hot. In the winter, the ice forms on our windows. And the air quality was bad. And given COVID-19 and the need to ensure good air quality, this had to be looked at. Asbestos were on the 2nd and 10th floor, and we also had to deal with this. Initially, the costs were much less, but with the supply chain issues and post-pandemic, the cost increased. So we are still looking to because we have petitioned WHO for some resources to help us with those renovations. We were expecting word from WHO, and we're hoping that it will be positive as well. So this is an investment, not only in the building, but an investment in the health and well-being of the staff of the organization. And I thank member states for taking this into consideration and for not raising any objections to that. We've waited a long time, and I think this is an opportune time to do it. And it will be my gift to the PAHO staff. Thank you.
Well, I think that if I may. Sounds like a vote of confidence there, Madam Director. If I may add to the justification, I think to be a hemispheric health authority, if you will, and not symbolize both in real and in appearance, health and wellness by having windows that are compromised and asbestos would be a grave injustice to the message that we seek to promote among member states and among our population. So I certainly think that this should have happened a long time ago, but we're happy it is happening now. So thank you very much and commendations for your leadership on this. Thank you very much. I now ask the rapporteur to submit the proposed resolution.
Gracias, presidente. Buenas tardes.
Thank you very much, Mr. President. We have proposed resolution. Use of the balance of the PASB Management Information System surplus. Preambular paragraph 1. Having considered the update on the Master Capital Investment Fund and the Master Capital Plan Implementation, document CE 171/6 PP2, recognizing that funds from the PASB Management Information System, PMIS, surplus are needed to support ongoing implementation of the Master Capital Plan, PP3, noting that the Executive Committee has been delegated the authority to review and approve proposals for the use of the PMIS surplus funds pursuant to Resolution CSP 28.R16, 2012 of the Pan American Sanitary Conference resolves. Operational paragraph, and there's only one, to approve the allocation of $2,102,000 to the balance of the PASB Management Information System surplus to the Master Capital Investment Funds Real Estate Maintenance and Improvement Subfund for use in the ongoing renovation project. That is all. Thank you, Mr. President.
Thank you very much. The floor is open to the plenary for any comments, any discussion on this issue. Okay, I see no indication of an interest in commenting. I therefore, with no objections, I declare that the resolution is adopted. Oh, yes. I always wanted to do that. Sorry for doing it twice. Okay, let's proceed to the next item 6, other matters. As we are dealing with other matters, I asked the director whether she wishes to put any other matter before the executive committee. Madam Director.
Thank you, Mr. President. I think what we have is sufficient, so there's no more to add. Thanks.
Okay, and are there any other matters? I yield to the plenary. Any other comments or any comment on any matter? Oh, I see the United States.
Thank you, Mr. President. Before we end this very important session with both the director and the deputy director of PAHO being women, I think it's important to note that we've discussed at the sanitary conference the importance of women in the healthcare field. Over 60% or more of the healthcare workers in our region are women. They have dedicated not only themselves to the promotion of health and the health and well-being of others, but also to their families. And many of them are struggling to be able to afford keeping food on the table, taking care of the family, and doing their job, which is very difficult. As we move into this next year, we would propose that we discuss how we can ensure that women in the healthcare field, especially in the Americas, are able to get equal pay for equal work, are able to have opportunities for advancement, are able to have educational opportunities. We think this is critically important, and the time for discussion has long passed. We need to move to actual policy recommendations to make this a reality. So we would want to work with all the countries in the room here and all the member states of PAHO to really promote this idea. It's part of the America's Health Corps, but it's something we all need to do each and every day as health policy experts, as political leaders, and the time is now. The time is actually it was quite a long time ago to do this, but we really need to commit to ensuring that women in the healthcare field are given what they deserve and the opportunities, and the time is now for us to recommit to this. So before we end the session, we would just want to bring this to the floor for consideration as we go forward. And it really should be something that is incorporated in all the policies of PAHO to make sure that in every aspect of our work, we're focusing on how we can ensure that women are given equal opportunity and equal access to the same benefits and opportunities of others. Thank you very much.
Thank you very much, United States of America. I think it's worthwhile comments made, very valuable. I would like to say that from my vantage point as a Minister of Health in Jamaica, during the most turbulent health threat that we have faced in 100 years, our frontline workers at the community level, in the accident and emergency wards, were overwhelmingly, I dare say, 80% and above women. And so not just is there a point to be made of the participation generally, but in terms of the risk profile within the spectrum of public health, our women normally are the ones facing the greatest threat. So I do share that comment, and I will say that it will be reflected in the committee's final report. And so if there are no other comments, I see no. Oh, Madam Director would like to comment.
Thank you, and thank you, United States of America, for really raising this issue. I think that under the health workforce agenda item, we could highlight this, and also in our gender equality cross-cutting program, we could include this with a specific focus on women healthcare workers. Thank you.
Thank you very much, Madam Director. And so if there are no comments on item 6, I move to item 7, which is closure of the session. And I ask Madam Director for her final remarks.
Thank you. Thank you, Mr. President, and good afternoon. And let me say I'm impressed with how quickly we've gotten through this agenda. And let me thank, and it's not because you are not participatory or participative, but thank you that you have seen the wisdom in some of the agenda items that we brought before you, but also the agenda items that you have presented to the Secretariat. This is my last executive committee meeting as well. I have many lasts now, but let me say that the executive committee is an important governing body committee. It is you who gets to look at particularly the policy items. It is you that shape it. It is you that reviews the resolutions that go before the Directing Council or the Pan American Sanitary Conference. And the success of the Directing Council and Pan American Sanitary Conference, the ease with which the agenda items can be reviewed and resolutions passed depends significantly on how diligent you have done your work as the executive committee. Over the years, PAHO's executive committee has played a major role in moving the agenda, and particularly on the policy matters, but importantly also with the administrative, financial, and budgetary issues. So I want to thank all of the executive committees and through you, but also to commend you on having accepted the responsibility to be part of this group and to wish you well. You are the watchdogs for PAHO, watchdogs for accountability. You are the watchdogs for transparency. You are the watchdogs to ensure that the Secretariat is actually addressing the priorities of member states. And so yours is an important role, and I want to wish you well. Thank you very much.
Let me also take the opportunity to, in closing, to recognize you again, Madam Director, for your leadership. This represents, as you say, your last executive committee oversight, participation, leadership, but certainly not your last participation in public health matters. And I'm sure we will see you here in the future. But we want to commend you and place on record your contribution. And I know I speak on behalf of all the members at this level of the executive committee. And we certainly wish you all the best. To members who are here who were very efficient in their participation or lack thereof in terms of comments, that is, I want to thank you. I think we have an excellent agenda that is relevant. So it's now up to the work that will take place after this with the changes that will occur, which we are confident will continue to grow and expand the influence of the Pan American Organization for the benefit of the people of the Americas. The only thing left for me to say is that the malls close at 8. There are good restaurants around, and you have an hour or two to relax before you embark on your next phase in preparation for your return home. Have a safe trip home and good luck to all, and long live the Pan American Health Organization. God bless.
When we are, you told us.